So we'll be getting an update this afternoon on our adolescents with high behavioral needs and an update from diversion. So with that in mind, members of the committee, any comments before we get started, or thoughts, questions anyone has on our intent for the day? Good. So I'd like to turn the time over to Mrs. Ballard with the Department of Education. The K-12 Mental Health Service Committee that Chairman Baldwin was in charge of had been working to really help us understand what the role of the school, what are the role of the schools in providing mental health services. And we talked in a very broad sense over the last couple of meetings, but I think we need to refine that down a little more and hopefully be able to determine just what it is we expect our schools to do, and then what we anticipate, or the mechanism for providing mental health services into that. So Dr. Ballard, would you mind just walking us through what you have been doing and how it relates to the questions that we've asked, and perhaps kind of give us the committee's feelings on how this task force should move forward?
Mr. Chairman, absolutely. So I think it's been a while since we've actually kind of talked about some of these pieces, so it'll be interesting to kind of think about where to go with them. I think we kind of have been working on the set of questions that are kind of listed on the agenda. So we've been talking about, really what is the role of like the school counselors and kind of the pupil support staff that exist in schools, and thinking about what really should they be doing. And so we've been talking about whether or not I think that whether counselors should be providing mental health services. I know we've talked some about the fact that even when our Project Aware, where we're able to, for the kids that are a part of that, we're able to get services to them for the most part in about 30 days. There are these 30 days where they're not receiving services. We know they need help, and what do we do with them then as well? So I think that the first question is probably a good place to start. I think that counselors, when we start looking at what counselors should do, I think that like the idea of schools kind of putting into place some screening to help figure out if the students need supports, mental health supports and those kinds of things. And so I think that makes a lot of sense, right? It's not necessarily like it's at a higher level, right? Just kind of thinking through what is it they really what students really need, right? And I think that makes sense for schools to do.
So do you mind if we ask questions as we see them? So as we referred to this in the past, we kind of asked the question, do we want schools to identify and then treat, or are we expecting them more or less to have the capacity to screen and identify that we have a problem? And so if I'm understanding you correctly, you're saying have those individuals, be it a counselor, as you said so far, that would be able to screen and identify mental health issues with that student population. Am I seeing this accurately?
Yes, Mr. Chairman.
Okay, please proceed.
I think that in terms of like providing care for students in that regard, I think we've seen a lot of success in being able to provide those services in partnering with the community or partnering with telehealth providers to be able to provide a lot of supports for students. And we've seen a lot of success in being able to get students in and see progress being made, right? And being able to see them released from needing the mental health services. So I think there's definitely some, Mr. Chairman, yes.
Thank you, because so in doing this, have the schools that you've been working with thus far, have they then been providing those services in-house, or have they been contracting those services? The services may be done on campus, but so when I say in-house, I'm referring to school staff providing the mental health services, or are they contracting out and having those services brought in, or is it a combination of both?
Mr. Chairman, what we've seen work really well is the school districts are contracting the services out in partnership and coordination with their family and parents, caregivers. And so we've seen a lot of positive work being done when it's contracted out. We do see it benefits that when the school district is involved, that if they have space available, if they can make space available in their school district, so there's a location that the kids can go, they don't have to leave campus, we don't have to worry about transportation, those kinds of things. We have the ability to bring parents in. They can come into the school, or they can come in through telehealth when we need them there as well, or when they're needed as well. And so I think that it's worked well. We have had students, like in some of our districts, they take the students to the provider's location when it's not a telehealth, when it's not using telehealth and using someone in their community. And in that case, the school district is transporting them back and forth. Again, it makes it easier for parents, so the parents may not have to take off work. They meant to try to be able to get their kids to the counseling appointments and those kinds of things, and being able to incorporate them in. Yes, Mr. Green.
So a couple of questions, if I could. The first one would be, so a counselor identifies that we've got, let's just say that a student's having a meltdown. They screen, they identify it. What do you do for this emergency intervention?
Mr. Chairman, well, I think that it's definitely starting with talking with parents, right? And figuring out kind of their wishes, desires, needs for the students, right? So it may be that they are good with the school counselor providing support. They may have.
So are they on the phone with the parent while this kid's having a meltdown in their office? I mean, so we identify, this student comes in, we identify that he's really got a challenge, and I don't think that this would be in every case, and I'm trying to get in my mind what we're expecting the schools to do. And so as they screen, it appears to me that they're going to have to do some kind of temporary, or I don't know, some kind of intervention to protect the child's safety and protect perhaps the safety of others. I don't know. So how do you see that?
Mr. Chairman, so while a student is having meltdown, right, they have staff, behavior interventionists, they have their counselors, their social workers, their school psychs, their school nurses, right, that have skills in being able to support the student in the immediate moment, right, to be able to do that.
And is it then your opinion that that would be an expectation we would have of the districts to have that capacity?
Yes, Mr. Chairman.
So then when you step past that and we start going to the community for intervention, the two questions would be then rural districts, which may not have community intervention. Do you have, how do you see that potentially playing out in the state? Would there be some sort of case management taking place at the schools or referral process at the schools? And then the other part is when you're in these programs that you had thus far, when you're taking the kids maybe out of what's the impact on the students' education if you're taking them downtown for services, or even at the school? Is that a negative impact, or does that upset the process any?
Mr. Chairman, so I think a couple things in there. I think there's a gap between like kids in crisis mode, right, for a moment, or is melting down in this moment, and taking care of that immediately. I mean, that's an immediate need right now. We have to face it. And then you screen once they're right? Like you screen after that.
Okay,
And then I think it's the conversation with the parent starts at that point, right? As soon as like you've got the kid in a better place, right? It is a matter of then working with the parents, right? About with figuring out what they want, kind of what their needs are, what their desires are with their student. I think that if the schools certainly have staff capable, typically, that could support students in the near term while we're working on finding like a longer term, support outside the school. I think that's possible, but I think a lot of that is up to parents, right? What do they need, want, how do they want it, right? Like some may not want counseling, right? Like some parents, they may have been identified for need, but they may not be interested or not interested in a mental health counselor pathway for them. And so I think it kind of works with them from there. So I think that's that piece. Removing them from the classroom, I think we do this all the time with kids, right? If I am struggling with reading, they will pull me from another class, from another subject or something like that to kind of double dip me in reading, right? And give me some more interventions and supports and things like that. So that's kind of done, I think, and schools know how to do that to minimize the academic impact on students with some of those. But if you don't do some of that, they'll continue to have some of those issues, and it will impact them across the board. And I think the same is true here, right? Like if a student is struggling with their mental health, if we are not providing supports for them, their academics are likely to suffer, right? If I'm really struggling with my mental health, I may not be focusing on my math or my reading, and I'm not able to absorb and learn as the teacher may hope. So by giving me the help and support, then I'm better able to take in the academic content as well at that point.
Mr. Chairman. Dr. Ballard, just a naive question. So after the screening and potential brief intervention, whether it's from an event or an incident or something that happens at the school, and then as you're mentioning kind of a referral into services with the parents to determine if any sort of ongoing treatment or service is necessary, kind of a similar question to the chairman's, what then is the district or the school's responsibility on an ongoing basis, if any, or is it we've done our screening, we've done our brief intervention, the referral has happened, and now we're, as a school, back to academics, back to just making sure or trying to make sure that the child is in school? Or is there ongoing management, case management, check-ins? How does that work, or is it variable across the districts?
Mr. Chairman, I think there's two pieces to that. If they're a special education student and they have an IEP, right, that all of these kinds of things will show up in those IEP meetings. And so there's definitely ongoing check-ins and determinations if they need to change the IEP and the interventions that are created in there. So there's definitely that.
If I can, sorry to interrupt, Dr. Ballard. That's not every student that gets an IEP, though, that if the student has an IEP.
Mr. Chairman, correct. If they're a special education student with an IEP,
Gotcha.
right, like that will always continue. The other then piece are the kids that don't have that. And we certainly have, districts have developed and are continuing to work through, some districts at least, this whole referral process, right? What do we do if we've identified a student through that process? I think it depends on the school district and somewhat depends on the student, right, as to what's happening, right? Our Project Aware districts have somebody that is specifically watching this, right? The referral pathways, they make sure that students are making it to appointments. If students aren't making it, following up with students and parents as to what's happening to make sure we've got all of those pieces covered, and there's a lot of case management going on. You may also have parents that are like, thanks for letting me know. I don't want anything more. You're done. This is mine. And they want to take it from there. And then I believe schools will respect that, right? Like, however, I mean, I do think they keep track of kids, right? In terms of like, Laurel's not doing well today. We may just want to check in and make sure, see how she's doing, right? Like those kinds of things, and kind of keep tabs on students just to make sure they're doing okay. But I don't know that I would say that they all have to kind of keep like a true like case management piece connected to it.
So committee, I think, or committee members, I think that this conversation with your Director Johannes, Dr. Ballard, is important in that my view of this is that we have our special education process in place. Those kids have an IEP, they're in the system, and we keep track of their progress. And so this conversation is not about special education. This conversation is about those kids that come that don't have an IEP, that have some other mental health issues that are being identified. It doesn't say that they wouldn't get an IEP perhaps, but once they get an IEP, they would come and kind of shift from this population over into the special education population that it has an established process. And so in my mind, as we have this conversation this morning, it's really about those non-special education students that are being identified as having some sort of mental illness need or services. Is there anybody that's seeing that differently than I am? And that'll be important throughout the day, because as we talk about the proposed legislation and perhaps different funding models, we've got to keep that, I think, bifurcated in doing that. So then my question, Dr. Ballard, is that it appears then once they've been screened, once they've been stabilized and screened, I'll get the order correct here, that then this referral process and this ongoing oversight would require some case management, for lack of a better term. But somebody is going to be overseeing that. And does that individual that oversees that the same person that's going to make the referral? Who's going to make the referral? Would that be the counselor or the professional here that has the ability to screen? Are they going to be the one that actually makes the referral, or is that passed to somebody that does that and then that makes the referral, and then the ongoing, what I would say, oversight of that isn't in place systematically for this population, but is in place for the SPED kids, right? So we're trying to replicate that to some degree.
Mr. Chairman, so when we think about referrals, right, referrals can come from a lot of different places, right? School nurses see students all the time, they'll refer. If you're in the Project Aware districts, we have teachers that refer as well. I'm sure that's probably true in some of the other school districts. I just don't know the details in the other districts. And then they make the referrals. They kind of do like this, the screening there, right? And then when they do the screening, then they work with the parents, right, to figure out what to do. And then they can refer out.
Are you saying the teachers are screening?
No, Mr. Chairman, they send a referral to somebody, like if they are working with.
So for clarification on referral for me, okay, because instead of, I get that within the district, within the building, the teacher could refer to the counselor. I'm talking about referrals for services.
Mr. Chairman, okay. So I just want to make some wording clarification. So we're talking the same thing. So we talk about when a student's identified as potentially needing support, right? They will then provide that information to the person in their district that's responsible for that. That person then, or group of people, will make sure they do that initial screening, and then they can work with the parent to do the referrals outside of the school if they need services. That better?
And so I'm just making, you can call me whatever you want, Mr. Chairman. This is the same for whether this is a second grader or a seventh grader or a 16 or 17-year-old. We're expecting that same level of support from an elementary to a high school level, even though that probably looks very differently on how to diagnose and screen and what that referral looks like. But that's the expectation, no matter where they are in K-12, even if they're an 18-year-old non-minor, we would still be providing those kind of services and screenings.
Mr. Chairman, yes. I like those questions. You can give me more of those.
So then, and I apologize, members, I'm slow to process stuff, so we're going to have the ability to identify. We'll provide that emergency, so we're expecting that the schools would have the ability to make that emergency intervention to screen and then make a referral for services. Correct?
Mr. Chairman, yes.
And then as they make in addition or in concert with making the referral, there would be an expectation that that student wouldn't just be dropped, that there'd be somebody monitoring the services or how that's going. And that comes back, I keep using the term case management, but that's what there's somebody at the school that, because they've made the referral, that they would be monitoring what's going on with that kid and how it's then going to impact back in the education.
Mr. Chairman, yes, I think that would be good. I don't know that that always happens.
How do you do that in Aware now?
So that is the community, as part of what the community project manager does. That role that we talked about, which is like the person that's kind of managing the whole program. And so the referrals kind of come into them. They work to make sure the student is screened, and for students that need to continue further, they work with the parents and the counselors and the folks in the school. And they already have, right, like the connections with the providers available, right, so that they can immediately start working with the mental health providers in the community or through telehealth to be able to start figuring out how to put the student on the schedule if that's the path the parent wants to take.
So maybe we could, if you don't mind, just expanding this conversation then to help us understand what you've learned from those pilot programs in Aware. And I'm sure that some of this will be what we've already talked about this morning, but this coordinator and how this is in the districts, if you'd remind us the districts that are being served or being tested with Aware now, if any of those are rural, kind of give us a feel of where they're at and just kind of help us understand what you've learned from that exercise.
Yeah, Mr. Chairman, so we have Campbell County, so Wyoming urban. We have, let's see, Fremont 1, so Lander. We have Powell, so Park 1. We have Carbon 1, which is Rollins. We have Sweetwater 1. We have Sweetwater 2, so Rock Springs and Green River. We have Evanston. We have recently brought on Niobrara and Goshen. We have it's kind of a shared model in terms of the community project manager in Bighorn 1, 2, and 3, and Park 6, Park 16, sorry. So if you don't know, that's Batitsi and Park 16, and I start to get the Bighorns mixed up. So I don't even want to mess it up publicly. So I can't remember which one is which city up there or how they're broken up. So we have quite a few that are working on it. Actually, I would say a lot of them are rural. Some of them are a little bit more populous. We have some really, I think we've had a lot of success in the rural areas. They use telehealth, typically, in the rural areas. I think the ones that are not using telehealth are Campbell, Fremont 1 in Lander, and Park 1 in Powell. So those are the ones that are not using, they're using somebody in their community to provide the services versus, and everybody else has telehealth.
Do you know those that are getting services in the community, are those community mental health providers, or are they independent providers in the community?
Mr. Chairman, yes, they are.
Both, or one or the other?
I'm sorry, ask the question again.
So I'm trying to understand what the resources in those communities that are providing those are. Is it the community mental health providers, the local community mental health provider, or which is a group that's funded by the state?
Yep.
Or is it an independent provider that maybe has his own shingle nailed up there that is doing that?
Mr. Chairman, they're all independent providers.
So walk us through what you've learned.
Okay, so what we have found is that when we have these dedicated efforts and working, we're finding we can get students in much faster. We have found that we've had students that have been in institutions that have come back. They've been a part of this program, and many of them have not had to return back into institutions, which is, I think, a huge result, because they are frequent flyers in the institutions. And so we are happy to see that the wait time that we've had, right, takes them down anywhere from like 30 to 60 days, which I think is really strong. I think that in terms of even like the community health centers, it kind of relieves them a little bit of some of these kids, right? Like so they can take on others, right? So that because we've been able to find partners. The telehealth has also worked really well because we can have people located across the state, right, and working with these kids. We have found that if you're doing that, especially in the younger grades, having a paraprofessional or a CNA in the room with a kid to help make sure that they're able to focus, kind of help keep them focused and working with the counselor and not running around the room and not paying attention kind of thing. We have found that as well. I think we've seen, and I apologize, I can't pull off the stats that Mr. Brown provided us last time, right? But we have definitely seen some and positive results coming out of it. Some of those are now statistically significant results that we're seeing. And so we've seen a lot of positive connections or positive pieces for the students. I think the other thing that we've done well in the Project Aware is that coordination with parents, right? And like we don't move forward without parent permission, parent support. And so then it makes it better or caregiver coordination. Like it makes it so much better for the kid, right? When we have everybody working together and working in the same direction. What we've also seen though is with this model that we've been able to do family support as well, because frequently these kids, it's not just the kid that needs support, it's involvement with the family and the student, right? They don't sit by themselves when they're at school, they're in school, and then when they go home, they have their whole family. And so it also it kind of encapsulates that as well, which I think is really important as we're talking about the long-term well-being of the student, making sure that we've provided that support for students as well.
Mr. Chairman.
Go ahead, Director Johansson.
Dr. Ballard, this might be different for the Project Aware districts versus the others. For the community services that are contracted or the telehealth services that are, how is that procured? Is that an RFP? Is that at the district level? Is that through the Department of Ed? Or is it kind of any willing provider can enroll and be available to provide that service? How does that get purchased?
So, Mr. Chairman, just because of the nature of the federal grant and the lack of time you get, and you have to have the provider named in the Project Aware grant that with SAMHSA, we've been working we go out and have contacted different providers that provide telehealth successfully in the state. Otherwise, and so we have gone directly to them to find out if they would be willing to be a part of this and hear the requirements. So we haven't done an RFP for it just because time doesn't allow for that. and you have to have it in the grant to get it approved, right? Like the people, they're approving all of that upfront when they go through that. So we haven't done that. I do think it's something that could be done. I mean, if we weren't.
Has to be done.
Follow up, Mr. Chairman?
Right. I mean, I would prefer it to be done that way, but we just don't, we don't even have it, we
Director
don't have the
Johansson.
time otherwise.
Yeah, thank you, Mr. Chairman. Dr. Ballard, I think, long-term or longer term, the sustainability of it is my question. So is there a provider network right now for the either community services like in Fremont or telehealth services where either the districts or the department can say, here's the providers we have either through the grant or outside of it are contracting with to provide those services? Or is it a, kind of a, as you're saying, timeline on the grant, we just go enroll providers, anybody who's willing? But is there something for the districts or the state that could say, here's your menu or your options when it comes to providers of who you can contact depending on the child's need?
Mr. Chairman, we have not done that, but that sure would be a good idea.
I think that brings us up to kind of the question that we would need to be making a recommendation on, because right now that those are being funded through a SAMHSA grant. So as this task force looks at, Madam Appropriations Chairman, as we look at funding, how do we look at funding this? Is this something that we would anticipate would be a funding model that would come through the Department of Education's budget request? Or are we thinking that this might come through? Do you guys have any idea on how directors, you guys that do this on a regular basis? And then I think would we develop an RFP? You wouldn't do an RFP, I think, statewide, but you would just have to be able to have funding for a district to be able to access services, right? Am I seeing that wrong? How has anybody had any thoughts on that? Director Johansson?
Thank you, Mr. Chairman. I think, again, in our world, it depends on the population and the service. So kind of a dynamic of, who the child is, and we've talked about the different tiers of need and those types of things. In our current system, our community mental health centers operate generally for outpatient on a general access system. So that's all subject to their capacity, their availability, their wait times, et cetera, as we've heard in previous meetings. In the redesign system that'll take effect next year, for the state funds, it's prioritized, as you well know, and there's a category for the high needs adolescents that meet certain conditions or get referred by a school, Department of Family Services, other entities, and then become a priority population of a community mental health center. So that's the kind of the access vehicle there. Outside of that system, then you look at what's the pay source of the individual, the child or the family. If it's a Medicaid child, then school-based services for an enrolled billing district can come into play where there's a pay source there, and schools can provide that service on site, or Medicaid enrolled provider could provide it. So it really is variable, and I think it, not to be irritating, but as I've said in a couple of meetings here, comes down to the question you asked at the beginning of today's meeting. What's the role of the state? Non-special education kids that are identified as having some mental health need during their schooling. What's the role of the state to provide that? And that's really the nature of my question. If that's established as an expectation that all districts will be either providing or referring and paying for those services, then the questions of procurement come up. How does that get procured? Is it highly variable, like is being experimented with now on grant funding and access to providers, or is it more of a static, we're going to have this baseline of services like Director Schmidt and I contract for in communities to say, this is your population, we'll do an RFA or an RFP or however that gets procured, and contract with a winning or several winning, awarded entities for some level of service and set those expectations through contract. I think, again, that role of the state, that mission of these non-special education K through 12 kids, of establishing that fundamental policy up front, then would govern what do we do 2 years from now in the K through 12 system, assuming grant funding runs out or changes or what have you, that we want to set as that standard expectation. In our world, it really does depend on those pathways that you come in. So community mental health center, you have these pathways both now and upcoming when we reform and redesign the system next year. On Medicaid, you have a pathway for access to providers both in the school, if it's a school-based services district, of which we have 5 right now. 1 billing, 2 ready to bill, so 3 potential billing entities, and that could grow. Or outside providers that would then, for the K through 12 district, would just be a referral. This is a Medicaid child. We have a provider in the community or in another community, telehealth or otherwise. We're going to leverage the family's pay source. In that case, it would be Medicaid. Those are all those questions and dynamics that go into it. So I don't have a good answer for how would it be procured. It really depends on what's that mission for K through 12 mental health outside of special education, and then what would the department or the districts be directed to buy on a long-term basis. So I think I answered the question with about 20 more questions, but happy to elaborate if it helps.
Would it be fair, Director Johansson, Director Schmidt, and Dr. Ballard, as well, is to say, though, that it's helpful for us to determine our recommendation on what we expect. If we understand what the expectations are for the school, then it delineates out what or responsibilities for securing services. Because if we think that we're going to do it within the school system, then we're going to be funding the model somehow, right? Director Schmidt?
Thank you, Mr. Chairman. So I do think it's a complicated question and answer, but I also want us to bring us back to why it is that we would be having this conversation at this level. So with the Department of Health and Department of Family Services, we bring in a lot of complications because the people we serve are complicated. What I see this opportunity as, the discussion about who pays for it is different.
In addition to the legislature that you serve, being complicated?
Yes, yes. It's that inherent idea about immediacy and access. And what we see in our system, in the Department of Family Services system, is that we receive a lot of children and families when they're in crisis, and they're beyond that point of a smaller, less intensive intervention. And so as we talk about pay, which I think is important, and who's responsible, also recognize, though, that at some point the system may end up paying for those families anyway because they've gone beyond a point where a smaller, less invasive intervention could occur. So when we refer out, when we're talking about schools, and we have counselors who are in schools that are helping to kind of manage day-to-day, kids that come in with maybe a little bit more difficulty at home, and helping them understand in the school how to engage until we get to that point where there's an escalation, there's some sort of higher level intervention. A referral or a screening is done, a referral is made, and then there's a need for a higher level of intervention that may or may not involve the family, hopefully so, but we will see. And I think accessing that service at that point is incredibly important. And what I think Project Aware does is it brings in access. Whereas if we're to leave families on their own to kind of struggle through our systems, then do they? One, are there so many barriers there that they don't? And then 2, ongoing ability to provide that service. So I'm not disagreeing with the fine director of the Department of Health, but I do want us to recognize maybe too that this is really about prevention and access more so than about what's the state's role. Does the state have a role then in making sure that there is access and that there is immediacy?
Mr. Chairman.
If I may, before, so I think there's a fundamental question that I'll ask the members of the task force. Is there anybody on the task force that does not feel that the state has a role in helping our schools address mental health services for those non-special education kids as they're identified. Now, we can discuss to what level, and that's a different thing. But with the challenges we're seeing in schools, is there a role for the state to, and in that, when I say state, that's the schools, that we have to be able to address the increasing mental health needs that we see in our schools? Or do we just leave it alone? Is there anybody that feels like we just should wash our hands of it and say good luck? Please.
Mr. Chairman, thank you. I do struggle a little bit with kind of wrapping my brain around this because, and I appreciate Director Johansson's questions earlier about IEP and are these kids on an IEP? And we determined, no, this is the population of kids that are not on an IEP. And I agree with Director Schmidt and the challenges that she faces in her agency, but some of these families, the kids are having mental health issues that when they can access mental health treatment and deal with those issues, they will go on and live productive lives, and they will not become part of the system. And so I struggle with your question, Mr. Chairman, and what is that role for, if I'm a parent and we're having a crisis in our household related to the mental health needs of my child, I think it would be extremely helpful to be able to go to my school and say, help me, and they help me connect with where I need to connect. Beyond that, I don't know. I struggle with that question. I don't know. I think we are in a situation where we do need to help our communities and our kids and our families, but to what level, as a parent, I don't know. I struggle with that piece of that question.
Thank you, Mr. Chairman. I do struggle with how we have, I don't think we have accurately identified the population we're trying to target, nor have we heard, I think, meaningful feedback from the schools and primarily the teachers about what type of services they think would be helpful within the school system itself. You know, everyone comes to this committee with their own experiences and lenses of who is the population we're thinking about as we try to help. You know, so from my perspective, coming from the county in the state with the highest suicide rate within the state, that always maintains some record of that as well in the country. Those students who I know committed suicide before I graduated high school were nowhere near touching DFS or had an IEP. They were successful students who had friends and were involved in activities and came from good homes and still chose that as an option. And just recently, this past month, now the cycle continues where my dear friend that I grew up with, her 15-year-old son, just did the same thing with no warning signs and nowhere near needing an IEP or heading into DFS attention or concern. And so those are the population of students that I'm thinking about. Isn't the obviously high-risk students who already have maybe some resources or eyes on them that are clearly identified as knowing that they probably need additional supports. It's those that don't signal those kind of challenges or those concerns, which is why I think we're seeing an increase across the country with all populations of suicide. And that is affecting Wyoming as well. So is that increasing access in our entire state, including K through 12? Certainly, I think that is helpful if we can increase access to mental health care and make it a priority for all of our population, including K through 12. But I do feel I don't have enough information about how to provide that resource to K through 12 without hearing more thoughtfully from those teachers who may have a sense of those successful students that are in trouble and don't quite know how to connect to them. That's my perspective.
So Chairman Nethercott, if I may try and dive into that a little bit more. So when we say that we feel that the school needs to have the capacity to screen, because right now we're saying we've got this whole population, so who needs the help? So we're saying that we agree that the schools need to have the capacity to screen and identify, right?
Yes, I think screening is helpful, but I don't know that I don't think screening would be effective for the population I'm thinking about. But I think screening certainly could identify some of those that are at risk of needing mental health services.
Okay, I want to come back to the population that you're thinking about, but okay, let's capture the population that we would catch through screening, and then be able to have, as we identify them, and have the capacity then to refer them for services. We meet with families, say, we've identified this, are you seeing this at home? These are services that are available. They may have insurance that take care of it. They may not. They may be they may be Medicaid eligible. They may not. But for this conversation, they don't have any other resources. Are they then a priority population that our community mental health providers can provide services to? Or what if they're in a community that doesn't have a community mental health provider providing services? Then how do we get those? So I'm just trying to say, where's our role as the state? And is there not some suggestion there that say we're going to have to be ready to help as the schools identify services available in their respective different districts to help provide do something there? And I don't need a definitive, I'm not looking for a definitive answer, but it appears to me that that's probably a role that the state has to help to a degree, and we're going to refine that. So then I'd like to come back to this population that you're saying is still out there unidentified. How do any suggestions, how do we identify those?
Well, I'm not sure that I'm equipped to answer that question, but but I'll do so. I suspect it has to do with mental health awareness, both for the individual who is experiencing those feelings, and then the ability of those around that individual to identify that in that person. And then education about how to access a resource. So in my mind, when we're talking about the model, is it referrals and we do this big wraparound and, like we're used to seeing for really high-risk students? And my thought is no, because those students are pretty savvy and they will eject out of that as quickly as possible and have the ability to do so because they're getting good grades, because they're involved in activities. They have a family that loves them, right? And so they'll be able to navigate out of that rapidly. But so it needs to be a more subtle, softer touch. And I don't know if it's, an extra office next to the school nurse of a licensed therapist that's always available, or what that looks like. I mean, that's why I think the feedback from K through 12 is helpful to understand what that is. Referrals are referrals. I mean, everyone knows, I think, how to Google a mental health therapist if a parent knows that their child is experiencing some of those challenges. And there's the 2 clinics in town that if they're lucky, is providing services or taking patients. So I don't know what that looks like in Wyoming, and I don't really understand what those needs are on the ground. But in my mind, it really is connecting with that population that seems okay.
Dr. Ballard.
Mr. Chairman, Really glad you brought that up. I think it connects too with what we've talked about before, right? Like that we kind of bucket these kids into different tiers. And so kind of what you're talking about is, we call it the multi-tiered system of support, right? I mean, that's the education jargon for it. So you have like the tier one, which is kind of the education piece that you're talking about for everybody, for kids, for teachers, for faculty, staff. And it is very much about that, right? Like about providing youth mental health first aid for faculty. It's about providing suicide prevention for kids. It's about, right, and kind of the things that you would want to do for all kids. And if you have a really strong multi-tiered system of support, you have groups of teachers and counselors and school staff that meet on a regular basis to identify kids that, and it's two-pronged. One is academic, right? So who are the kids that are having academic problems? And then thinking about the behavior side, right? And thinking about where we might be seeing some of this. And and then it allows you to kind of think about how to provide, so identify kids that maybe needed some more intense supports or interventions and we start kind of doing a little bit more support there, right? And providing more intervention and that kind of thing. And then when the kids are we still identify some that are clearly still struggling. That's when we kind of hit this tier 3, which is what we've been talking about, right? Like I think if you remember the graphic I gave you a while ago, right? Like it's almost like a tier 3 has so many different layers inside of it. And we're starting to talk about the kids that are needing the mental health services and beyond we're talking about that. And so I think that kind of what you're talking about is really like working with school districts and funding for school districts, this idea of this truly implementing a strong multi-tiered system of support, because it would pick up a kid, like maybe it's academics is where I'm seeing it, and maybe it's not. Maybe there's something on the behavior side that I see that identifies the kid. And then we realize, oh, wait, right, maybe it's an academic side, and you realize it's really something else going on the behavior mental health side as well that you need to start picking up. And so having both sides of this pyramid in place, I think is really helpful. And when you ask about the role of the state too, funding something like that would be really helpful. That's what we've been talking about, right? Like we have lots of stuff that kind of goes on in tier 1. We have instead of a pyramid in K-12, it looks more like an hourglass, right? So we have a lot of schools that kind of do suicide prevention, some of those kinds of things. And then we have districts, especially after COVID, that have been doing a lot of work on getting kids mental health supports. But that tier 2, like where we should be catching a bunch of kids so that they don't have to end up in these upper levels, that's the piece that we're really missing for the most part in K-12. It's hard, and I don't think anyone has defined it well and exactly what to do in there and how to do it well.
Could you explain, so again, go through tier 2 and who they are?
So tier 2, like when you find a kid, maybe they've, let me think for a second. When we talk about tier 2, these are kids where I may be talking about, I don't have anyone at home. They start to talk about, talk to a teacher, let's say, about the fact that I'm having a lot of trouble at home. My mom's always mad at me, right? Like, and you can start to see like an escalation in the behavior side. And if you're academic, you start to see failure or close to failure in some of the different areas, right? And so then when you have these kids, they are identified and you start bringing them into this. So it could be that we're doing something as intensive as group counseling. I mean, that's kind of at the top level of that. But I think inside a school, that's when there's like more intensive interventions around like suicide prevention and more intensive efforts around, if we're talking about academics, more academic kind of like the interventions and like I pull a kid out for reading supports or those kinds of things. And so those are those kind of kids. And when you hit tier 3, these are the kids that we referred, we screened, we realized that they really do have some mental health issues that need to be referred outside to a provider. And when you're at that level, you kind of go out of tier 2 and you're into tier 3, getting the more intensive, that kind of intensive support. Is that helpful, Mr. Chairman?
This whole conversation has been extremely helpful for me, and I think for me, as we try to make recommendations to the task force back to the legislature, when we talk about funding, we talk about the state's role, and that generally includes some funding, then the conversation is, how can we use the current services and funding that we have in place? What do we need extra, and how does that look, and who does it come through? I don't know that we've clearly identified that today, but I think that we, at least for me, you've been very helpful in helping me understand, at least opened up some of the areas that we need to focus on and look at what we do. But I think for the schools and the districts that are watching this conversation, it just really is important for us to hear from you to, one, help us understand what you think the role of the school is. Do you want the whole enchilada? You know, do you want to now become an educator and a mental health service provider for all your students, or do you want to, as we kind of been leaning in this task force to provide, to have the expectation that the districts would have the ability to intervene temporarily, to screen and to refer, and then monitor, which in some cases may be a new addition to things that you do, but probably not. So we want to, but we don't want you to feel like you're at the dumping ground for everything else we can't do. And so then you're going to have to pick up the slack and save the day. And so I agree with Senator Nethercott that we, as we continue this conversation, and we're not today we're going to have this conversation on K-12, and then we're going to look at the resource model for professional services, counseling, nurses. I always can never remember that term for the other services that are support services. Is that what it is? It's anyway. We'll be talking about that bill coming up, but I think we'll be moving forward with this broader conversation, Mr. Chairman, on further defining the state's role and coordinated the efforts to get these services into K-12.
Thank you, Mr. Chairman. First, my apologies to the committee and to everyone for being late. My morning is struggling. I forgot to check out from the hotel. Perhaps I meant to stay there. Anyway, thank you for accepting an apology. And I think the Chairman Larson nails it right on the head. And I think in my own mind, I'm thinking, we've come to a river. We got schools on one side, we got state on the other side. It's a deep river. And we got students that are being identified that need to get to the other side of the river. We need a better bridge. We need a better way to get back and forth from that bridge when they get services to get back into the schools, and from the schools to get them to there. And I think that's my view of the conundrum that we have, is that we need to build a better bridge. We need to make it where it's available to get from one side to the other. And that's going both ways. It's not just one side to the other. And my own personal opinion, my own personal thoughts here are that the state probably doesn't bear the responsibility to fund the schools to do all this on their own. The whole enchilada, as we've heard, is probably a bit much. Maybe a mini burrito would be better. But I think that certainly there's better things that we can build. We can better equip them. The funding model we're going to talk about in the bill, I think, is a piece of that. And I wasn't here for the whole conversation. I know that I invited somebody in from my constituent county in Lincoln County, and Senator Dockstedter's here as well, to talk about where this constituent called me and is very knowledgeable, has very good opinions, and I think it would be beneficial to hear from her and from Senator Dockstedter perhaps before we go into that funding model. Interesting. I'm looking at the schedule here, and it says successes and failures of AWARE. And I'm hearing lots of successes, but nobody's talked about any failures. Are there none? Is it perfect?
Wish. We certainly haven't figured out sustainability. But failures, we've seen breakdowns when you don't have strong communication between the mental health provider going back to the school. As you talked about, like that case management before, we've seen breakdowns in communication, and we've had students that have fallen through cracks when you don't have that. And some of them have been, end up in the hospital after having committed suicide. That wasn't real fun. So we've definitely seen some of that. So these like structures that we put in place, we have to figure out how there's really strong communication for that. We still don't see all the kids that need to be seen, right? Even if we see about 4 to 5% of their population, and we have more kids than that probably need help, but we can only have so much connected to that. We have where we've seen like the community project manager shared by multiple districts, we've seen some pretty big breakdowns there. And then between like the school districts that own the staff person and the districts that don't. And so I think there's multiple reasons that cause that.
Can I ask a question on that?
Yeah, Mr. Chairman.
So it sounds like that person is really, really critical on all aspects of this coordination, communication with the parents, communication between the teachers, if I'm understanding the position correctly. Is that being, in where these projects are being run, is that being done with an existing faculty member, or do they bring on a new person specifically for that?
Mr. Chairman, it's a new position in the district, whether they hire someone internally, some do, some pull from internally, and some have hired someone from outside that they brought in. But it is a brand new position inside those districts.
And so you, having seen this working in the various districts and perhaps maybe in some of the smaller districts, could it be done? So and I apologize for my stuttering and dance around. So I can see the challenges you'd have if one district has the employee and then they attempt to share it with other districts.
Yes, Mr. Chairman.
That always adds complication to it. So on small districts, if they didn't want to share with another district, is it possible that that could be done with an existing employee, or does it have to be another new employee?
I think you need to dedicate time, how they choose to do that. I think there's lots of ways they might be able to do it, but they definitely need to have somebody that's dedicated to that work. But it could be a part-time position. I mean, in our role, they also do things like support. They work with the mental health aides to make sure that we've got wraparound services. So it's kind of going back to what Senator Nethercott was talking about, right? We start to identify they have additional needs, and maybe they qualify for Medicaid, and helping them, get Medicaid, and some of those kind of, and whatever other wraparound services they may need. And so they help with some of those kinds of things, and having someone that's really focused on that has been really beneficial. I think that's why that's part of why we have so many successes here, is because we've got a lot of supports for kids coming at them in a lot of different ways with this, having this person that's working on that. But I do think you could, if you're in a small district, you could share it, but you could also increase some of those tier 2 kinds of things, and like the wraparound services, and supporting the staff with helping kids with life and soft skills, and doing more in terms of this multi-tiered system of support, providing more supports inside of that. I mean, you could do it lots of different ways, Mr. Chairman.
Mr. Chairman, can I
Please.
take a brief privilege? I've never gotten to ask that. I wanted to introduce the committee. We have a couple staff visiting from Buffalo at our Veterans Home, our Director of Nursing, Jesse Davis, and our MDS nurse, Delisa Morrison. They're going to be very surprised that I'm doing this, but it's not every day that our facility employees come down and observe what we do here in Cheyenne. So they're kind of playing tourist this morning and seeing how the sausage gets made here in the Capitol. So welcome to Jesse and Delisa.
So you're at the new skilled nursing facility? Thank you. It's a lovely facility. We're anxious to see it more utilized. Staffing's moving along. Great. Thank you. We have a lot of excited people ready to receive those services. That's great. Thank you for being here. Okay. I think we're going to move into some public comment on this discussion that we've had thus far. If we've got some representatives here from education, we'd love to hear from them. If we could, Katie, I'd like to see if we can connect with Megan Osmond. That's a Star Valley name, if I've ever heard one. Megan Osmond, who is with Kindness Matters. And if we could get her on. Hi, Megan, I see you. Can we turn the time over to you and have you explain to us what you've been doing and how we might benefit from that? Are you from Upper or Lower?
I am from Grover, so in the Upper Valley.
That's an important question if you talk that Star Valley jargon. I can't tell you which is upper or which is lower. I just know that that's the question you asked. So, okay, thank you.
Thank you. Thank you, Mr. Chairman, for inviting me. I really appreciate the opportunity. I am an educator. I worked for Lincoln County School District number 2 for the last 10 years. Unfortunately, my child was sexually harassed her freshman year in high school, to the point where I had to remove her from school in order to give her the time and space to heal. And in the interim, as I had to resign my position to come home and take care of that. Gratefully, I was in a position in which I could do that. Unfortunately, most people are not. I am an anomaly. Most people in my position would not have had the option to come home and take care of their child. In the interim, I decided to build an app. It's called Kindness Matters EDU. And it is designed to create a culture of kindness in our secondary schools. I used my culminating project of my thesis to do copious amount of research and to make sure that that was going to be effective. And thankfully it is. I would really love to speak to this, particularly for, I love the Project Aware framework. The Thrive framework is brilliant. And it hits all the pieces that are needed inside. In fact, I appreciate the committee member who was talking about these students who are not on the radar. This is such an important piece to mental health. It's not a physical illness, you don't see it. And those who are high achievers are struggling with it just as much as those who are not on any counselor radar. And so the 3-tier system that Dr. Ballard has put into effect is brilliant. As far as the tier 1 being universal, those are the students that we need to educate. And that's the part that education, the Department of Education just needs to, we need to educate those kiddos about mental health. We need to break down the stigma of mental health. The tier 2 system is your group work. The kids, and in my experience, I'm going to back up just a little bit. I'm a district librarian, and what I did and what I really focused on is building programs to meet the gaps. So basically to fill the gaps of education, the things that teachers would like to do, but they do not have the time or capacity to do that, such as digital citizenship, such as tutoring programs that help our kiddos who are in need. In my experience, what I did was gather up those kiddos, those high achieving kids that they didn't feel they belonged. So they are not in any sense of belonging. They they ended up in my libraries. That's what would happen. They're the kiddos that ended up in my libraries because they didn't know where else to belong. I would gather them up and I would pair them with the kiddos who are struggling, and I would build tutoring systems, and I would build all these kind of things that really helped. And the powerful combination was those kiddos who are smart and capable, but yet struggling, and those kids that really needed help. giving those kids that are smart and capable a service opportunity to help others is what helped their mental health. My Kindness Matters program really capitalizes that and fits the bill for your tier 2 system. And then your tier 3 is your crisis situation. In schools, I can attest to this, counselors are giving 78% of their time to crisis situations. And so we need a collaborative effort to meet those tier 2 and tier 3 students. And so the Thrive framework that Dr. Ballard and Dustin Brown have put together really hits that really well and brings in their Project Aware brings in a learning collaborative. And I love that, because having a representative from a variety of stakeholders to guide and direct their program in the locale is going to be super important. I love Chairman Larson's question. What is the responsibility to fund and what isn't? I would like to offer a suggestion. The suggestion I would offer is the key piece that needs to be funded is that person in the district. You need either, I don't know if it's a part-time or a full-time position, but the job description needs to be very specific. And even if you use Dr. Ballard's Thrive framework as a way to create that job description, that's going to be the most important funding piece. And then the other piece is the access. So the Project Aware and the Thrive framework really is what Senator Baldwin is saying is the bridge. You're opening access. I just want to testify that there are many of us, like myself, who are out here. I have the funding from the Hughes Charitable Foundation. They have seen what I'm doing and said, yes, I will give you funding. So there are foundations, there are people who want to help in this mental health arena that are outside, that are private entities, that are outside our state funding, but we have no access. Department of Education is so wrapped in red tape, like most things, government, right? And there's a reason for that. And I totally understand we live in a litigation world and this is the way we have to live. But because it's so wrapped in red tape, people who have the funding, have the means, are willing hearts to get in there and help kids, they don't have the access. So this Project Aware and the Thrive framework builds the bridge. It gives the access. So I don't think the state has to fund the whole thing. I think they really have to focus on that one person in every district and then allow local control. And so you just give the framework, which Dr. Ballard has already created, and then you give funding for a position, but it needs to be focused on this. What happens if the job description is not specific is districts have a tendency to roll them over into something else, which is not, they're struggling. They need more counselors. They have massive crisis. But if you have that person in there with that job description, they can focus on preventative measures. And your chairman from the medical field can probably attest to, efforts spent in prevention will save money over time, will make it so that we have less students in that crisis mode. And so that's kind of how I feel about it. Thanks for letting me speak on that.
Thank you. Megan, committee, any questions for Mrs. Osmond? So I do. So surprise. So Megan, we've got a bill before us that we're going to be talking about a little later on. In being an educator, you would probably understand to some degree the funding model for education. And we put into the model, depending on ADM positions. And so we have pupil support and counselor and school nurse positions. The rebasing or recalibration that was done in 2020 made a recommendation of counselors based on population at middle school and high schools with a minimum amount of, of one counselor being in the district. And so this bill that we're contemplating would look at that population and make that perhaps it would give the districts the opportunity to increase those positions, school nurses, counselors, or pupil support. So in your testimony, you said that this coordinating position, the term I'll use, is the critical component. Is that per district, per school, tell me how you see that from your perspective, because as we have this conversation on perhaps increasing the number of those professions that support student mental health, are we doing it in the right way in this bill is kind of where I'm asking. So does that question make sense to you?
Yes, it does. And it's a really great question. And from the top of my head, I would say you need at least one full-time person per district. And this is a terrible thing to say, but there's this saying in education that says, so goes the person, so goes the program. And that is so true. So if I was a superintendent and I had this one position, I would do everything in my power to make sure that person was very dynamic, very capable of communicating. And if that one position in the district could then access the basically army of counselors. So as you're increasing counselors, and I can only speak for Lincoln County, we have a counselor in each school. And then we have more than that in the high school where it's more necessary. So that person, that one full-time person in a district, could then work with all of your counseling and their systems. They already have screening systems in place. They already have all of those systems. So that one person in the district could start to really access that and then bring your other stakeholders in your communities, in your areas all together. But that if you have one person, Chairman, and you have the right person, it can get done. This collaboration effort can really get done. I don't necessarily think you need one for every school, but I could totally be wrong on that. But I think a one solid position in the district would do the job. Did that make sense?
I said, thank you for Senator Dockstader. We love him, and we love Representative already. He's a good guy. And thank you for joining us today. Okay, any other public comment on this portion of our meeting? If you would, as you come up, if you'd be kind enough to just identify yourself and who you represent and
Good morning, committee members. My name is Janet Farmer. I am a school nurse here in Laramie County. I've been a school nurse for 16 years here. I'm also the Wyoming director to the National Association of School Nurses. So I kind of cover a broad territory. I will tell you that I had some prepared remarks. I have rewritten them over the last hour. So I hopefully won't jump around very much. My original purpose for coming this morning was to voice support for the continuation of the state position, which is the state school nurse position at the Department of Education. I'm also overjoyed as I read through some of the documents that school nurses are included in that. A lot of times school nurses are not forgotten, but we kind of work in the background. So we're not always at the forefront of the mental health piece that is very, very important in our schools. prior to having the state position, the state consultant position at the Department of Education, school nurses across the state worked very much in silos, very much alone. A lot of these processes that you talked about today certainly are in place, but as the person that we just heard from said, the processes may be there, they're just not accessible. We didn't have school nurses who could actually talk to each other to know what works best for others in different parts of the area. So this school nurse consultant at the state level provided us with that voice and that collaboration to be able to work together to know what is out there. The position that was created at the Department of Ed was created in 2020, and this person did a phenomenal job bringing together, showing people at the Department of Ed, the Department of Health, what was out there and what we could do together as a team. Some things that I just wanted to bring up that were done. The consultant worked to develop a platform where we could share information. Prior to having this position, we didn't have that. We all recreated the wheel almost every time. But we knew after this platform was in place where we could go to find that information. She collaborated with the Department of Ed and the Department of Health and also the Board of Nursing to provide state-required trainings, licensure information, required reporting, so that we could also get that same information all at the same time. She facilitated monthly meetings so that we could all share information too. One thing that's really important, and this kind of applies directly to this committee, the consultant was able to pull together or make a required reporting piece for information that's collected from school districts. So we now have, we've gone through a pilot year for our new required reporting. We'll start with a requirement for all districts this next year. And that pulls together aggregate information on medical and behavioral health diagnoses, vision and hearing, special ed, substance abuse and bullying, and any nursing challenges that school nurses see across the state. So we will be starting to actually collect data on what those school nurses are seeing. In the pilot program that we completed this last year, every nurse that completed that pilot questionnaire reported daily mental health challenges in dealing with students. And that was a very small number of school nurses that were part of that pilot. So we anticipate that that will be a much bigger number as we proceed, but it is a daily thing that we see with all school nurses. The consultant was also able to work with professionals in the field to develop guidelines for vision, hearing, standing orders. So these primary and secondary prevention tools help us use our knowledge and skills and abilities. When we're talking about tier 1 and tier 2, this is kind of where the school nurses play into that too. We can start to see maybe some of these health things that play into the mental health piece of prevention. And if we can see those early and tackle those early, hopefully that we can prevent some of the tier 3 interventions that may be needed. And finally, the consultant was able to advocate and implement professional development specifically for school nurses focused around resiliency and burnout. If COVID-19 showed us anything, it's that we need to take care of ourselves before we can take care of others. So the mental piece affects not only the staff, but the students and the families as well. So as those mental health and social determinants of health affect our students and our families, it's really critical that nurses recognize that in themselves as well as in all that they take care of. We've talked about the teachers and the support staff. Many times the school nurses are that first point of contact. We see it over and over again. Students will come to us with any myriad of physical symptoms or just behaviors that they're maybe trying to avoid, maybe not, but it presents to them as a physical symptom, so they may come to the school nurse first. Certainly, any training, all training that we can have, that the state can provide to all staff in recognizing those symptoms would be extremely beneficial. But if we can support that staff in providing that information, that would be exceptional. I would ask that you work to find continuing permanent funding for this state school nurse consultant. Right now, it is strictly grant funded, which, as we know, is precarious, maybe at best. But our students are our future, and our school nurses work very, very hard every day to make sure that they have all that they need. That's all I have for right now. I'd stand for any questions that you have.
Thank you, Ms. Farmer. Any questions, Chairman Swanisher?
Thank you, Mr. Chairman. My question is more on continuing education. I know it's district by district, but I mean, in the last couple of years with this kind of growing understanding of mental health, are your districts working with the school nurse? I know they have behaviorists and counselors, but are you getting kind of continuing education in these type of resource areas that I'm just guessing maybe in your educational background, they don't have a mental health for teenagers course as part of being a nurse, but do they have something that our district's really engaging on helping the school nurse understand that some of these physiological, they come in with a stomach ache, it really is a mental health stress response?
Representative Zwanitzer, Chairman Larson, I would say that every district probably is different. And I would certainly hope that there are a lot of opportunities out there district by district. I would say the better answer is, though, that the professional development that is open to school nurses has actually been a direct result of the state school nurse consultant facilitating that and making it available and known to school nurses across the state on where to find that information.
Mr. Chairman, thank you.
Chairman Nethercott, please.
Thank you. Just a quick question. Is there any special kind of certification for school nurses to be school nurses?
Ms. Farmer.
Senator Nethercott, Representative Larson, yes, sort of. There is an opportunity for nurses to become nationally certified. It's through an exam process and then a number of continuing education hours over a period of years. It's not specifically focused on mental health. It would be a very broad exam. I will say I've been nationally certified now for probably close to 7-8 years. And I will say it was the most difficult exam I've ever taken. So it is not an easy process, but it is an opportunity.
Mr. Chairman, thank you. And so who did your district help pay for that continuing education or certification? Why was it so hard? And can you tell me more about it?
Senator Nethercott, Representative Larson, my district did not pay for it. It was on my own. I think there are districts across the state that do pay for it, but we actually don't have very many nurses in Wyoming that have chosen to do that certification. I know there are different states across the country who require school nurses to be certified. So there are different requirements state by state. As far as the exam itself, why was it hard? I think it's just because it is so encompassing. I believe it was like 300 questions over 4 hours. And it could be that I was not in a good place to take an exam. So it's just it covered a lot of territory because as a school nurse, we work with mental health, we work with physical health, we work with students, we work with families, we work with staff. As a school nurse, you think about not only chronic health problems, you think about family situations? Do students have food? Do they have shelter? Do they have those kind of very, very basic needs met before they come to school? So there's a lot of social, emotional, physical health involved.
One just follow up, Mr. Chairman. And so is there any mental health kind of certification or endorsement that nurses can obtain besides psychiatric nurses? Is there something kind of in between there?
Senator Nethercott, Representative Larson, not that I'm aware of.
Further questions? Ms. Farmer, thank you.
Thank you.
Any other public comment? Please, come join us. So the first thing we want you to do is just relax.
Okay.
And it'll be fine.
All right.
You're amongst friends,
All
okay?
right.
So tell us your name, where you're
My
from.
name is Carla Langseth. I have been a school counselor in District 2 here for, District 1 for 20 years and District 2 for 2 years. I've retired last about 5-6 years ago, only because my husband and I decided to ranch way out in Horse Creek and the drive to town was incredibly hard to do. I've never left my kids. I am so full of wanting to help our kids. As an elementary counselor, I had over 250 kids alone. Those children would come to school on Monday morning after being at a divorced parent, mom or dad's home, and come, and they were just a wreck because structure was not the same. And I'm by myself, and I got 5-6 kids at the door, just, they can't even handle themselves. The teachers are going, can you come talk to this kid? He's just, something's wrong. And if this teacher has 15 to 25 kids in their classroom, and the kids are just hopping up and down, they can't control themselves, they just want to go to the bathroom all the time, or they get so upset that they're sent to the principal's office, because sometimes sitting in the chair in the principal's office is better, because somebody will talk to them. Monday mornings for a guidance counselor is like going into battle, and you're just, can I clean up the wounds of these kids? Friday afternoon, when they have to go home, and they're going to go home to a step parent or their dad or their mom, or they don't know where they're going to go or what they're going to do for the weekend. They're sleeping in a different bed or in a different home. They don't want to go home, many of them. Many of those homes don't even have food. I've had students come to school in the morning because I always bring food, cheese sticks, everything. And they come in my room and they get a cup of coffee, they get a cheese stick, whatever they can, because there was no food in their house all weekend. Friday food bags, if it wasn't for Friday food bags, then some of these kids wouldn't eat. And it seems so funny, not even funny, that as a guidance counselor of 250 kids, because your heart doesn't turn off, if those kids leave, you're worried. You're worried, well, how are they? And then you get a phone call from the principal that says, well, so-and-so tried to commit suicide, so we got to get together as a team. I mean, guidance counselors are on the cusp of everything that happens in that school. There's so much that goes on. I could probably sit here for 2 days and talk about it, but I can't. I did the elementary counseling. Not only did I do the elementary counseling, but I did all of the testing, all of the getting the testing ready, getting the books from the state. And once the state got in, then I had to get them out, all the classrooms. So that took me probably a couple of weeks just to get organized for that. And that's just elementary. I sat and watched elementary kids cry taking tests because I literally read a question on one of the tests that was the same question as a sixth grader's question. I'm going, what in the heck are these tests all about? These kids are crying because they didn't know what the heck was going on. You didn't prep them, because these were off the wall tests. One of the tests was, what is a ceiling? So if you're a kid that lives in an apartment or an attic, that's what it was. What's an attic? So if you're a child that lives in an apartment, you don't know what an attic is. I mean, so that questions on testing is really crazy. So then I go up to the junior high, and the junior high, oh my gosh, junior high emotional, social skills there are insane. I taught 8th grade health and PE here in town. I have to tell you, my health classes were amazing, and the things that I had to teach in health, literally if I That curriculum, so I actually helped build the curriculum. If I taught everything that the health curriculum gives the health teacher to teach, it would take me 365 days. So we're cramming so much material into the health, and then we only get to give those kids health, what is it, every 2 weeks? That was, I'm talking, this is 15, 16 years ago. And a health teacher really has to teach the biological going on, and the guys and the girls, and everything sexual. And this was 20 years ago. That's what the health teacher has to teach. That really should be a biology teacher, not the health teacher. Then I move up to high school. I have 500 kids. I'm responsible for all their credits, all their college, all their going into life, career events, trying to set up teachers with their classrooms, all the testing we do. It is incredible. Again, these kids in high school, they come see you Monday morning because some things happen. And of course, in high school, we can go on Facebook and find out exactly what they did because they post everything. So then we have parent meetings because kids are fighting over Facebook, parents are fighting over Facebook. We have a police officer trying to work. These kids, they come to school because they think it's a safe place, but it is not a safe place. We need 125 kids and one counselor. One counselor cannot take care of 250, 300, and 400, and 500 kids. And that one counselor can't go from one elementary school to another elementary school. Those children need to see a familiar face every Monday. They can't come to school after having a horrible week and not eating and having their parents fighting over custody and having just things happen in their home and not have somebody that they can talk to. And Fridays, we really should know who's picking these kids up. It should be, if you had 125 kids with one counselor, that'd be almost equivalent to what a teacher has as a load. You wouldn't put one coach on a football team or a basketball team you wouldn't do that. Why aren't we having more help for our kids? If you had 4 counselors in elementary school with 600 kids, you would have a team that can work together. And they can follow the students from 1st grade all the way to 6th grade. Then also make a mentorship program go to the 7th grade. And from the 8th grade, a mentorship program to the 9th grade. Every kid needs a mentor. Every kid needs somebody they can 100% trust. And I think you can probably get that done if you have more counselors. And I'll tell you what, if it wasn't for our school nurses, we would be really sunk. My last 9 years were at Triumph High School. We have a program called Discovery. It's a social emotional class that you have to take for 9 weeks before you can come into the school. The kids that came to our school that had alcohol, drug, social, emotional problems, when they came in as freshmen, when they left as seniors, they were a changed kid. I would highly suggest that you look at a program called Discovery. It's written by Eric Larson out of Fort Collins, Colorado. I really believe that that program should be at every school starting in 5th grade. We can get our kids in elementary. You got to get them by the time they're 9 years old. I did my master's in counseling, research that I did. Michigan State Prison had 400 prisoners at one time that they followed on death row. And they said that every one of them started their issues in 9th grade that they could find, 9th grade, as 9-year-olds in 3rd grade. So that 3rd grade, 2nd, 3rd grade is just so important. So many things change at that time.
Mr. Chairman? Thank you. Just a question. Thank you for your service to the district and helping so many kids in our district. I'm curious, based on your experience of over 20 years of doing this, what your observations have been over time. How are things different by the time you retired to when they started as it relates to mental health?
You know, mental health doesn't change because every person has a mind. Every person number one, I think what it starts with, every kid wants acceptance. Acceptance and respect. The ability to walk into a school and know that when you walk down the hallway, somebody's not going to roll your eyes at you. Somebody's not going to talk about your clothes. Somebody's not going to, just make up things. Kids make up things. A lot of things. And it's very hurtful. There needs to, the time that I think that's changed the most, because loneliness, everybody has loneliness. Acceptance, everybody wants to be accepted. You walk in, even as adults, you walk in the room and you don't know anybody, you're going, oh man, who do I talk to first? How do I talk to them? Am I going to be listened to? We don't listen to people very often. We just speak our minds. It seems like every kid I ever work with, my mom and my dad said, say what's on your mind. I'm going, that's not necessarily the best thing to do. Let's talk about how we should think about it before we say that. But I have to tell you that when I went to Triumph, and I think I left East High School at 08, I was a counselor at East. When Facebook came out and the texting came out, we lost our kids. We lost total control.
So if I can, because, and we appreciate the experiences, but now we want to hone in on your experience, and I want to follow up on Senator Nethercott. And so what I heard your answer to say is there isn't a change in mental health.
Much.
Or the mental health challenges. And so correct me if I'm wrong, is the time required, are we seeing manifestations of mental health challenges more in schools now than we did when you started?
Yes. Because social media.
Well, regardless of the source, the schools are bearing a bigger burden with the challenges that come with that. Would that be a fair statement?
Not sure exactly what you're asking me, but how I think what you're saying to me. Is it worse from 20 years ago than it is now? I believe it is worse because we are able to talk about it more, and kids, with this social media, like 20 years ago, kids just kind of held it to themselves. Now they can go on Facebook and they can say all kinds of things, and somebody else can come back at them. And they can make something that's small that probably could have been where they could have probably had some help. Now it's all of a sudden it's out in the open and everybody knows. And if I may, I did on my research on my master's, I went to the district office here and I pulled out 400 files of students who had dropped out of school. I went through every person from kindergarten to high school of the kids that dropped out. And in my data, I found that in kindergarten, they were not, 40% of the time they were in school. It went like the dropouts that dropped out literally missed 40 to 50% of school in elementary. And so when you miss that much school, you're conditioned not to go to school. I had a student, he was a junior in high school, and he came into my office, said, I can't come to school anymore. I said, what's going on? He goes, I just can't do it. So I pulled his folder out. I said, oh man, you didn't even go to kindergarten hardly. He goes, no. I said, you hardly even went to first, second, third, what's the deal? He goes, I didn't like school. I didn't want to go. I'd rather stay home and sleep. I said, your parents didn't make you go to school? He goes, no. I said, well, there's a reason you don't want to be here. I said, you're not conditioned to be here. So guess what he did? He went to LCCC and did just fine. That's it. Sorry it took so much time, but this is such a passion of me. And I'm now going back to work. I'm getting my professional license. And I'm going to work under a company here because I can't watch. I can't sit and watch anymore. I got to get into it. So, thank you.
For your time. Representative Martin. Welcome.
Thank you, Mr. Chair, committee. Sorry for my attire. I was at work and I was
It looks
listening to
great.
this and as a mom, right? And my kids are 30, 28, 17 in the district. And as an experienced student myself in a low-income district, a T1, where discipline was always a problem. I agree 100% with the counselor that just spoke and our nurse. We do need help. And it needs to start at the elementary level. I support the fact that we need counselors and nurses in our schools. However, it's not the school's responsibility also to take care of the family. I would put that on Department of Family Services and Department of Health as far as a referral to immediately go to Department of Family Services. Because we can focus on the child and we can focus on the individual, but at the end of the day, that kid still needs to go home. And if we don't help with that environment, then we're not actually helping that kid at all. In my opinion, I would prefer that. As far as telehealth, yes, it's a very good system and probably would help a lot of people. However, right now we have statutes that will not allow parents to access their electronic records. We would have, a person out in the country would have to drive 200 miles to review that record because they're not able to access it right now. So that doesn't make any sense to me. If we're going to put telehealth for students, we need to be able to access their records via electronic purposes. So I would ask everybody to make sure that when the repealer comes across, that Representative Ward put to repeal that, then the telehealth probably would look a little bit more appetizing to people. And stand for any questions.
So if I may, I'd like you to elaborate a little more on how access to electronic records is impeding the ability to use telehealth.
Well, right now, there was a parent out of Representative Ward's district that was trying to access their child's record via electronic purposes and was denied access to that because of a statute doing with smoking assistance. And that parent was then told that they have to drive to the facility, the hospital, or the doctor's office to access their records. Now, pushing for telehealth is telling us that it makes it easier to receive services from a distance or eases the parents' ability. Your child's going to get services at school, and then the parent's going to have to drive 200 miles to get the record to see what the services were provided. It doesn't make any sense.
Mr. Chairman,
Please.
Representative Trujillo, as a representative who would be voting on the budget bill this next budget session, what I heard you say is you are in support of increased funding for school counselors and nurses,
Yes,
and you would vote for that?
I would vote for that,
Thank you.
but I would not vote for telehealth purposes at this moment.
Okay, further questions for Representative Trujillo? And thank you for being here.
Yeah, thank you.
I've got to do, I have to confess, I'm not making the connection on, because if I heard Dr. Ballard say, one of the requirements that they have, like with the project whereas we're moving forward, is this communication with parents and the services provided. And so I'm not seeing, I think that that's one of the areas that we're trying to address and be very careful on, is so that there wouldn't be any restrictions on the ability for a parent to know what services are being provided.
That is our thought right now, and it is being done right now. The access is being denied electronically from a regular doctor's office. Because
From a medical provider.
yes, what's the difference between a medical provider and a mental health provider, sir?
Well, it would,
It's still a medical record that's not accessible via electronic purposes.
thank you. I'm just trying to make the connection, because I think if the services that this task force is referring to, and we based it on what we were doing through the Project Aware, that referring, and Dr. Ballard noted that very specifically, that what was important was for, in the referral process, is to make a connection between the parent and the services available, and to make sure that the parent is aware of the services being, and so in this model that we're looking at, I don't think that there would be a restriction of information to
So
the parent.
Sir, we're not going to add personal private insurance to this referral purpose? Is there not going to be insurances tied to this?
We don't have any specific plan proposed right now. That's what we're trying to figure out, Representative Trujillo.
Okay, I'm just bringing awareness
Yeah.
to the fact that the insurance companies are blocking access to records.
Thank you. Okay, any other comments, public comments? Senator Dockstader?
Thank you, Mr. Chairman, co-chairs and committee. Appreciate all your work that you're doing on this. Just a little follow-up to Mrs. Osmond's comments. We started this with a special trip out here to Cheyenne to meet with Jen Davis, explaining what she's working on and doing. That led us into the education community and some mental health there with some more meetings. And that led further to find the funding. And so I've been accompanying her to these meetings, either on Zoom or in person. That led us to a trip into Jackson to find the money in it through a foundation there that she referenced. We're going to continue working on that. And then it led us to your committee. And I thank you for the time to hear her. I think we've got something good here, folks. Fills a niche environment in the educational community. And it taps into what our youth know and understand. These in an app. And I've watched it. I've seen some success with it at our own local level. And she's already reached out to 8 other school districts. And I told her I would accompany her to other districts across the state as we work on this. Kind of, if I could conclude, Mr. Chairman, it kind of fits into something. Spent a lot of time traveling this state, and out on I-80 at midnight, they replay a news analysis show off the flagship station off the Wasatch Front. And it's balanced. It's so refreshing to find something balanced that doesn't lean one side or the other to the other. It's just a balanced approach on what we're doing with our government here in the country. And the commentator always ends his program with, see something that inspires, say something that uplifts, and do something that makes a difference. I think that's what we're doing with this one. So appreciate any consideration as we move all this forward. Thank you for your work.
Chairman Baldwin.
Mr. Chairman, thank you. I'm curious why you didn't question him what part of the valley he's from, the upper or lower valley.
Mr. Chairman, I'm upper, but I spend a lot of time helping everybody from the Grand Tetons to the coal mines of the Southwest. But I'm upper.
He's from the Walmart parking lot where he sleeps most of the time when he's on the road.
I don't think he sleeps, Mr. Chairman.
Jeez.
I would add a note here that we almost have a quorum of the Labor and Health Committee here.
Yes, you do.
Almost, but we're not going to vote, so proceed. Thank you for coming, Senator Dockstader.
You know, Mr. Chairman,
Yes, go ahead. Oh, you're not excused, Senator Dockstader.
well, kind of. This is just kind of a comment that I'm throwing out there.
Can you get a little closer to your mic,
Yes,
please?
this is just kind of a comment I'm throwing out there based on the information provided by the teacher who created the Kindness app. I grew up in Wyoming Public Schools, and I remember in elementary school having to do a class called Positive Action, which sounds very similar to the concepts associated with the Kindness app. And I remember a lot of criticism from the adults about having to do that. And the class and the curriculum was really about how to be kind to each other and how insults hurt each other. And anyway, I found it valuable as a child. I don't know that my parents thought it was a good use of taxpayer dollars, but that was my experience, and just curious about the history of that program, maybe from the Department of Education, to provide that information later about that program, how long it lasted, its impact, its effect, why we're coming back to it just a few years later or decades later with similar concepts. So just curious about that, and I'm really I'm grateful for your constituent, Senator Dockstader, who is really providing, I think, actual solutions, even though they may be something as simple as exhibiting kindness.
Mr. Chairman, Senator, thank you.
Senator Barlow has his hand up.
Good morning, Mr. Chairman. Good morning, committee. Thank you for the opportunity to join you remotely. So my question is not for Senator Dockstader, so thank you, Mr. President. But my question is, when somebody comes forth, and I'm referring to Representative Trujillo at this point, and they have a suggestion about a statutory impediment or something like, it's often helpful for them to actually provide the citation that it seems to be an impediment to providing services. Same as ways we're asking people who have suggestions, such as the app that was being talked about, they're providing that reference and that stuff. If there's things that are standing in the way, being specific is certainly appreciated. So thank you, Mr. Chairman.
Thank you, Senator Barlow. Further comments? Further comments? Please.
Mr. Chairman, members of the committee, my name is Tate Mullen. I'm the Government Relations Director for the Wyoming Education Association. First, I want to commend the work that you all have done here. This is incredible work, and we stand in full support of everything that you've done. The proposed legislation that you have for the increased funding, we see that as a very positive solution. And I have a lot of thoughts around this. Some of these might answer some of the questions that Senator Nethercott had. We talk about services, Project Aware, Thrive, the use of multi-tiered systems of support, and that's great. But what we need to recognize is that when we talk about those services, for them to be effective, we're talking about personnel. And this bill hits that nail right on the head. What we have heard from multiple folks, and to echo the comments of the previous counselor, this is the comments that I've heard from counselors, school psychologists, and teachers across the state, is that they are struggling. They are understaffed, and it is difficult for them to provide the high level of services, especially given the increase in needs that we are seeing across the state with our student bodies. And so, Senator Nethercott, you asked, why are we missing some of these students who may not land in DFS or may not land in these other areas? And anecdotally, the answer that I have heard from educators, counselors, and school psychologists is because they are stretched so incredibly thin that people fall through the cracks. And that those students who may not be displaying signs where we were fully staffed might be able to go, hey, that's something we should pay attention to. So without extending my comments any further, WA is in full support of the efforts that you all are working on here. And thank you so much for your work. Stand for any questions.
Questions? I just have one, and it's just, it would help me. You reached out and talked to counselors and school nurses across the state. How many and which districts did you talk to?
Mr. Chairman, so I went through the Wyoming School Counselors Association, the Wyoming School Counselors Association, the Wyoming School Psychologists Association, talked to folks from Shoshone, Lander, Casper, Cheyenne.
I'm writing, so.
Sorry. Shoshone, Lander, Casper, Cheyenne, Bighorn, Glenrock. It was a pretty extensive list. We had a lot of contact in working with some folks on this.
Well, we've just been trying to establish this morning that how this reaches across the state, and so that's just helpful. Thank you.
Absolutely. Thank you.
Chairman Zwoneser.
Thank you, Mr. Chairman. Mr. Mullen, so we're trying to find solutions of that statutory, and from what I continue to hear, it's probably, hey, we just need more money and we could better solve the problem. So I guess my question is, with local control, do you think the model is working, and then our local school boards are just not diverting the necessary resources, or do we think the model is off on this 1 to 250 ratio? I'm trying to look for improvements in the system where we can actually make a dent or a change. Any, I guess, ideas or thoughts?
Chairman Larson, Representative Zwanitzer, I'm going to take this in two parts. So let's start with the model piece. As that last recommendation from the consultants, Pikus and Auden, noted that we should probably be looking at and funding the counselors' positions and those pieces. I think if we were to remedy that, if we were to do that, which is, again, why we really like that bill and the idea that, hey, let's address this in the 2025 recalibration, and specifically looking at those components. If we could do that, I think that would offer a better solution within that funding model. Like that would help bolster that. And then your second question, I'm backtracking here for a second.
Mr. Chairman, is really just any kind of solid thoughts on, is there statutes? Right, money helps everything, as we all know, and I continue to hear that. And eventually, I mean, we can always throw more money at the problem, but is there any kind of structural things at the legislative level you think we should be doing that would better assist?
Chairman Larson, Representative
Please.
Zwanitzer, aside from really addressing that within the model, we do like the idea of local control, but being able to provide the resources and the personnel to really address that is imperative. Again, right to my previous testimony, when we talk about these systems of support programs, we need highly qualified individuals to really take the lead on that and to staff those positions to make those effective. So making sure that we do that would help.
Please.
And this is more maybe as an association question for the WEA. Is it the role of the schools to providing some of these services? I mean, that's where I struggle. It's about giving every kid an equal access to education. And sometimes the best thing is to remove some of these kids and put them in more specialized programs to help all the other learners in the classroom. And I'm trying to figure out what's the delineation from what the schools should be doing, and then what maybe it's a different state agency is. And so I'm just kind of trying to get the feel for the WEA is, should the schools be providing more services, or should we be identifying, recognizing, and then, putting them into more specialized programs and helping the other learners in the environment? I'm trying to figure out at what level the schools should be handling all of these things. As we know, it's just parents in some cases are not doing the jobs that they used to be in regards to raising kids and identifying these issues, and it just falls more and more onto schools. So kind of where is the temperature in the WEA for, we should be doing more of this, or you should let us teach and this needs to be somewhere else?
Chairman Larson, Representative Zwanitzer, great question. And I'll try not to provide a too long-winded of an answer. So we recognize, from the WEA's perspective, we recognize that when we talk about educating our students, we need to do that holistically, right? That when we educate the whole student, we're talking everything from the food services for those students who don't have access to food at home, to mental health services, because we recognize when students are tired, hungry, and unhealthy, either physically or mentally, they do not come to the classroom prepared and ready to learn. Now, that being said, we also recognize that, and there has been this great conversation within this task force over the past few meetings about what that looks like within a school district and what that connection to community mental health services looks like, right? Because there is, at some point, a handoff that needs to occur. School districts and the employees within school districts are not, they are not the solution to long-term mental health problems for our students. However, we recognize that those students, that is where they spend the majority of their time. That's where the majority of our time as kids is spent. Those are the folks who we see on a more regular basis, other than family members. And so those are the folks who are really in tune, or could be really in tune, to observing potential student mental health issues. So what we have viewed that as is a lot like the discussions you've had, is that as a frontline in student mental health services, it's the task of those folks involved with it. That's counselors, psychologists, classroom teachers, paraprofessionals, along that gamut, to identify those students who are at risk and may need additional services. For those who are higher risk or who are exhibiting dangerous behaviors, it is a triaged response because there are wait lines in our community mental health system. So making sure that we at least have that contact with those students, that there's this continuing contact until we can get them the professional outside help that they and their families desire and need. So it is a continuum of mental health care service within our schools and to those community mental health services, if that makes any sense at all.
Director Schmidt.
And thank you. I think the question that I keep coming back to is this idea about who's paying for it versus who's providing it. And what we're talking about today to some extent is who's actually doing the mental health service versus who's actually procuring the mental health service. And I think in your comments, what you're saying is that who pays for it is outside the school district's responsibility, but rather the school district's responsibility is to make sure that there's that bridge that's crossing between an identified need at the school to the service that's actually the clinical service that's actually necessary.
Chairman Larson, Director Schmidt. A yes and no to that. Absolutely, we want to make sure that there's that connection. But again, coming back to my point that when we need students mentally able to, or mentally ready to enter that classroom and be ready to learn. And there are school dynamics, there are school behavioral dynamics and mental health issue dynamics for students and educators within that building that they probably still need to have continued conversations with students who have, since moved on and they do have outside professional care. They still need to have those continuing conversations to make sure that that educational component is also met, that those students are in fact ready to learn and that there's nothing prohibiting them from succeeding as best they could.
Committee, we're going to take a break, be back here about 11 o'clock. When we come back, Dr. Ballard, I'd like you to just run us through that cost breakdown of the AWARE. And then Katie, if you'd let Matt know that we'll be ready for. He's sitting right there. Hi, Matt. Couldn't see you through the wall. So we'll be ready for him. So, okay, 11 o'clock. We'll be back. Katie, are we back on? Okay. Okay, committee, I'd like to have us refer to the mental health, to the memo from Dr. Ballard, statewide project aware costs. You'll recall that we, at our last meeting, had asked her to, with the pilot programs around the state, if we were to anticipate implementing project aware statewide, what would those costs be? And so, Dr. Ballard, if we could just have you go through that memo and give us what your conclusions are and how that works, we'd appreciate it. I think we've read the document and understand the associated costs, but just if you'd summarize that for us, please.
Sure, Mr. Chairman, so if you go to page 3, really the overall total cost is about 13.6 million. So annually, yes, sir. And there's really 2 sets of costs. There are, the way Project Aware works, that there are certain things that the districts do, and then there's like professional development and technical assistance, some of those kinds of things that we do at the state level. So there's a set of costs that are at the district level. So I think on page 2, you'll see that the total costs for the districts are about $12.2 million. And then the state cost to be able to continue to do the same kinds of things that we've been doing with our aware districts, it's about $1 million.
So if you would help me, when you talk about those total district costs for the 48 district, the 12,240, is that cost that the districts incur through the model? How, or would that need to be an infusion of new money to the model?
Mr. Chairman, when you say the model, are we talking about the funding model?
Thank you. I'm sorry. The model.
So, Mr. Chairman, I mean, I'm not sure I consider.
Are those existing funds that the districts have available?
No, Mr. Chairman, like with Project Aware, these are brand new funds that we use with the school districts, and so that's how I treated it
Okay.
in the cost estimate as well.
Okay. So these would be new dollars that would be incurred by the state. And when you say state costs, is that WDE, is that Department of Education cost then?
Mr. Chairman, for the most part, I will admit I did not talk to Director Johansson about this piece, but the Project Aware is really a partnership between the department and the Department of Health. I think our staff does majority of the work, but we do a lot of coordination work with Department of Health. And so I did add in a position for Department of Health. I just didn't want to make an assumption that they had someone ready to just do this. So I gave them that position. The rest of them are the department costs, the Department of Education costs.
Okay, so task force members, if you'll, pay attention there on page 2, we've got the behavioral health provider contract support. That'd be support that the districts contract out with to provide those services. So how we, to some of the sidebar conversations as we look about procurement and who'd be responsible for what, I don't think this fully answers it, but kind of gives us an idea of the services being provided by Aware, and then look at, it might help us as we make a recommendation. I don't know that we'll have a complete recommendation today, but it helps us kind of understand the foundation of where we're trying to get to. Any questions for Dr. Ballard on this? Okay, Mr. Wilmarth, if you're here, we'll be going to the document. Anna, we'll be ready for you to present this bill here after we get done with Mr. Wilmarth. So we'll be looking at the K-12 funding model, many mental health personal comparisons memo, which is going to be an important understanding as we then go into the bill that we're going to be taking up for consideration. So if you would, Mr. Wilmarth.
Thank you, Mr. Chairman and members of the task force. Again, my name is Matt Wilmarth. I'm an LSO Senior School Finance Analyst. And this information is brought forward to you as a request from the task force's August 9th meeting. At that meeting, I presented a comparison of the current K-12 funding model's allocation of resources for pupil support and counselors. And then I compared that against the 2020 recalibration recommendations from the legislature's consultants for pupil support, counselors, and then they extracted nurses as a separate component through that recommendation. And so at that meeting, the task force requested myself to go back and analyze how districts are currently allocating the resources through the funding model and compare that to what the model allocates them. And so this memo is responsive to that request. The methodology I used is the same methodology that the Department of Education uses in its annual report to the Joint Education Committee and the Joint Appropriations Committee on how districts allocate all of the resources through the block grant. And the pupil support category within the model is a generic category. It does not necessarily direct specific resources for mental health, but for purposes of this analysis, I took a broad approach indicating if districts are going to utilize a component within the block grant for purposes of mental health, it'll be under the pupil support or the counselors components. And this would be specifically for non-special education students. I did include in this memo special education staffing because I think that it's important to recognize that the block grant is only for non-special education staff. So if a district does hire a staff member to provide special education services, that is a separate funneling of money to districts through a reimbursement method. So a couple other comments before I get into the charts and the numbers is this is a strict position count analysis, and it does not yield the information if a district were to contract for some of these services. So that should be I think there was some discussion that districts do contract for some of these services. And so this information or analysis that we have at the Department of Education doesn't necessarily lend that information to the task force. Additionally, some districts in the data indicate that they pay they do what they call additional duty pay. So you may have a nurse that receives an additional stipend or a counselor that receives an additional stipend on top of their base salary that may be coded as one of these staffing categories. It will not be picked up as a position count. It'll just be coded as a additional salary. That again is not included in this analysis. So for example, let's say you have a full-time counselor and they're more on the guidance counselor track, but they also provide more mental health guidance or mental health counseling, and they get paid an additional stipend for that duty. That will not be picked up on their FTE. They're capped at a one FTE. So I just want to provide a couple of the caveats that what you may see in this analysis that districts aren't expending all the resources or hiring all the staff, but they may be actually expending all those resources in some other manner.
So Matt, I just, before you get into this in detail, when we talk about pupil support and we go to appendix, say, the second to the last page there where we talk about funding source and assignment, and you see audiologists, therapists. Is that a reasonable list of pupil support? Is that kind of what we refer to when we're trying to get in our mind the types of people that fit into that category?
Yeah, Mr. Chairman, correct. So this methodology that has been utilized has been informed by school districts to the Department of Education. They have a school finance state advisory committee that has recommended positions or assignments that would fit within a pupil support component. And so they've advised that these are the positions that would fit within that component. There are other positions that may not fit in that. So I tried my best to replicate that methodology for that purpose.
And then just to reaffirm what I thought I heard you say just a few minutes ago, as we look at these numbers in there and as we look at pupil support in this manner, this is the non-special education pupil support for student services.
Mr. Chairman, that is correct. But I did include the special education counts for the committees or for the task force's information. I think it's important to
Right.
recognize that there is some duplication amongst those assignments, whether they're funded by state funds or state funds through the block grant or reimbursement through the special education funding.
And then as we get ready to, and Chairman Baldwin, this may be a question to you, but as we get ready to consider this bill that we have, this draft bill, I think the intent of the bill was to ensure that is to increase the number of counselors that we have in a district. And so bear that in mind as we go through this and we see what the allocation for counselors or the pupil support people are and the actual numbers, because that's important as we contemplate the content of the bill. Thank you. Matt, please proceed.
Okay, thank you, Mr. Chairman. So on page 2 of the memo, figure 1 illustrates in the light blue the number of pupil support and counselor positions that districts hire. And then that dark blue and the number above that indicate the number of additional model positions that I would deem are unfilled. So if you look at last school year, 22-23, school districts hired 493.6 positions, and the model had in excess of 26.6 unfilled positions. So in total, across all 48 school districts, the model allocated 26.6 more positions than what were filled.
So they had an allocation for 519. You add the two, right? So they had capacity for 519, filled 493.
Mr. Chairman, and you're looking at that correctly, and so I kind of showed that on figure 2. I kind of showed the inverse of that. Figure 2 is just the funding model positions broken down by counselors and then pupil support. So in total, in school year 22-23, the model allocated in total 520.2 positions. 340.1 were related to the pupil support category, and then 180.1 were under the counselor positions.
Please, Chairman Swanister.
Thank you, Mr. Chairman. Could we just talk a little bit about what pupil support is? Are those paraprofessionals or behaviorists or, what's pupil support when it comes to positions?
Yeah, Mr. Chairman and Representative Swanister, as I indicated, it's kind of a generic component, and it's really a component that allows districts to hire social workers, additional counselors, nurses, whatever type of position that they feel they need to hire based upon their needs in their district to meet kind of a family outreach, social, psychological, non-special education position. They are funded at a teacher salary or compensation level. So it's a professional, what we consider a professional position that would be a licensed position that would be hired by the district.
And again, you could see a good list of those on Appendix A. Second to the last page.
Mr. Chairman, so how do you count them for pupil support versus, we just need another school nurse? Are we just kind of saying everything that deals with behavioral mental health is additional pupil support? There's no box they check that this position is designed to meet state and federal standards for additional assistance in special ed or mental health training. It's just a grouping of everything else that kind of deals with mental health. There's pupil support. I guess is my question. How do you delineate?
Mr. Chairman and Representative Swanister, it gets back to the methodology that the Department of Education and school districts have utilized in the past to group or categorize these specific assignments in Appendix A into that pupil support category. It doesn't necessarily have to have a certain training dedicated to mental health. But as I opened with, the pupil support category or the counselor component within the block grant are the components that districts would have available to them to have a mental health program or positions to fulfill that need within their district. And the department and the districts have categorized these assignments that fit that purpose.
If I, Matt, on that figure 2, on that 520 total broken down between 340 on pupil support and 180 on counselors, that's the funding model, not actual count.
Mr. Chairman, that is correct. This
Thank
is
you.
strictly what's being allocated through the block grant.
Thank you.
And Mr. Chairman, turning to page 3 in table 1, this is just another way to look at it. Since 2012, school districts have been able to report to the Department of Education how their staff are funded, whether that's through state funds, federal funds, or other funds. And so what I did in this table for the past 12 years is identified the number of pupil support and counselor positions that are either considered non-special education, which is the analysis you see in figure 1, and then also identified the special education folks that are reimbursed under the state's special education reimbursement model or paid through federal funds under IDEA or other funds that the districts have identified as special education staff. So in the first column underneath the special education heading, you'll see that the 498.1 FTEs corresponds to figure 1. So that first column under state means those are state-funded, non-special education, pupil support or counselor positions. In addition to non-special education positions, school districts hire staff with federal dollars. So this would be either their consolidated grant programs or other federal money that they're receiving other than IDEA. So in addition to the state block grant model dollars that they're utilizing, they're hiring, as of school year 22-23, additional 68.3 positions just for these types of assignments. And then there's a small fraction of positions with other funds, and this could be local community funds that they have. So in total, non-special education, pupil support or counselor positions for last school year equated to 563.6 FTE. Then when we go to the special education columns, the state has reimbursed for last school year, or will reimburse this school year, 435.9 special education positions with the same assignments that we've contrasted on the non-special education side. This isn't just special education, general education teachers. These are the same assignments that have been utilized under the pupil support position. In addition, they hire 32.9 positions under the federal funding category. And then as of last year, no positions were hired under the other category. So in addition to the non-special education funding under this state special education or federal special education funding, additional 468.8 positions have been hired. So close to a little over 1,000 positions are being hired for either pupil support or counselor positions. And all of this detail is contained within Appendix A in tables A1 and A2. And you can see the details for each of those types of assignments.
Excuse me, Matt, what percentage of our population, roughly, of our population have an IEP and served by SPES?
Yeah, Mr. Chairman, for K through 12, it's about 14%. Finally, Mr. Chairman, on figure 3, this again just compares the data a little bit in more detail and it provides for each of the years the K-12 funding model FTEs and the actual FTEs for both counselors and pupil support, just a little bit kind of a more apples to apples comparison for each of the years.
So a question that I have that I thought this was really an interesting, your figure 3, that the actual number when we show this is almost opposite of what you was telling us yesterday when we met with the Joint Education Committee, where we showed fewer number of teachers based against the allocation or the number of teachers allowed, and they, for a variety of reasons, but mainly for the compensation part of it. This indicates that we've got an allocation of, in the model, for 167, but we actually use more, and pupil support as well.
Right. So, Mr. Chairman, my two observations I saw out of this analysis was, in total, districts hire more counselor positions than what the model allocates, but they hire fewer pupil support positions. So they trade off or utilize the excess pupil support resources to hire more counselor positions. And that's probably the reason, the likely reason is they're hiring elementary counselor positions where the model doesn't allocate counselor positions. If you recall, the model only allocates the counselor positions for the secondary grades, and it doesn't allocate those resources at the elementary grades.
But doesn't prevent them from using the flexibility within the model to put someone there. And so you lead into my question. It appears within the model, this funding model that we have in existence, that it allows for flexibility to address this counselor per pupil ratio. They have the flexibility to do that now. But yet I think that was something that we were trying to address in the bill. And so I just throw that out there as we discuss the bill, because I'll need some help from the committee, because I'm not sure. But it appears that flexibility. Now, so total between counselors and pupil support, that 498, do we under or over? What's our, we're at 490, we're allowed, okay, so we're allowed 526 in actual we're under about 30 in the total count, right?
Yeah, Mr. Chairman, if you go back to figure 1 on page 2, that'll show you that difference. So at the very top, those
At
figures,
26,
those numbers,
yep.
for this last school year, it's 26.6. And it's varied across years. The highest was in 2021, where there was about 62 FTE difference. 13-14, it was the lowest at 15.5. So, but you're right. The districts have the flexibility under the current structure to trade off pupil support and counselor positions and utilize those positions as they see fit. And as I said, the pupil support is a generic term. It doesn't specify a school nurse. It doesn't specify a social worker.
Then you further indicate in your memo that in the 2020 recalibration that they had recommended actually a different ratio. We elected the one that we're complying with now, which is within junior high and high school. The bill that we're going to contemplate actually refers back to the recommendation from the consultant to consider ensuring that those are there at a school level, so elementary, junior high, and high school. And so part of the question I think that we'll have to consider is, do they have the flexibility to do it as we currently have? Or do we need the bill because what we currently have doesn't provide enough positions? Is that Right, Mr. Chairman, is that what? Okay. Thank you. Please proceed. Just trying to tee up for the conversation, Matt.
Thank you, Mr. Chairman. So yeah, that's my final comments lead into what the bill actually does. And you're right. So the bill forwards the 2020 recalibration recommendations for counselors, pupil support, and nurses. And to kind of recap what the impact of that is under the current law for counselors, they're resourced at a rate of 1 counselor position for every 250 secondary students. Under the bill draft and the recommendations from the 2020 recalibration, it allocates 1 counselor position for every 288 elementary students, plus the 1 for every 250 secondary students, with a minimum 1 counselor position for each district.
Right. Well, go ahead, please.
Thank you, Mr. Wilmarth. Would you please repeat what it is that currently we fund the ratios?
Yeah, Mr. Chairman and Director Schmidt, under current law, the allocation is 1 counselor position for every 250 secondary students or middle or high school students. The only change under the proposed bill would be to add in the elementary grades, and it would be at the ratio of 1 counselor position for every 288 elementary students. And then there would be an overall district minimum allocation of a counselor position of 1. So when you combine that ratio or the allocations under those ratios, if a district has a 0.75 FTE, they would get an additional quarter position to get them up to that minimum of 1.
So that increases the total amount of teachers by how much?
Yes,
Or
Mr. Chairman,
that category.
the total counselor positions would increase by approximately 158 FTEs at the cost of approximately $13.5 million.
Would it, if my math is right, would it be, if under the current actual model, you could reduce that by the 26 that we have allocations for that aren't filled, because they have flexibility to take those 26 now that aren't. Am I making sense there? I'm just trying to. So our currently we have the model, but there's 26 of those spots that aren't filled, and they could use it for whatever they wanted to use it for.
So, Mr. Chairman, I think you'll want to look at it in a holistic approach for all of these positions, in that I think right now the districts are offsetting additional counselor positions with hiring fewer pupil support positions.
So that would account for the 26 unfilled positions, is probably they're compensating differently to get the people there.
Yeah, Mr. Chairman, correct. And if you look at I attached my August 4th memo. If you look on the very last page, this table 1 on the August 4th memo illustrates the net difference for each of these positions that are contemplated in your draft bill. So this is where I'm pulling my numbers from. I'm not just remembering. I don't have that good of a memory. So on the counselors, as I indicated, it would be an additional 158 FTE at a cost of 13.5. On the pupil support, the recommendation from your consultants is actually a decrease from the current law. It would modify so the current formula allocates a pupil support position based upon 1 position for every 100 at-risk students. And we define an at-risk student as the unduplicated count of a student, whether they're free and reduced lunch eligible, an ELL student, or they're mobile in grades 6 through 12. So under current law, we allocate 1 pupil support position for every 100 at-risk students, with a minimum for each school based upon the prototypical sized school. So under the elementary schools, you get 1 position for every 288 students, less whatever their at-risk count is.
Okay.
2020 recalibration recommendation modified the pupil support allocation to only provide it based upon the at-risk count at a ratio of 1 position for every 125 at-risk students. There is no allocation based upon the size of the school or the prototypical size school. So that's why you see a reduction of 95 FTE and a corresponding cost of $8.2 million.
Okay.
And then finally, Mr. Chairman, the 2020 recalibration recommendation pulled out or added a separate component for school nurses at the ratio of 1 for every 750 students in the district. And it provided a half FTE minimum for the district. And that increased or provides 123 FTE at a cost of $10.5 million. So all in, under that recommendation as compared to current law, is an increase of 186 positions at a cost of $15.8 million. And all of these positions, Mr. Chairman, would be funded under the average district's teacher compensation level, which is how they categorize them.
Questions? Okay. Please.
Thank you, Mr. Chairman. Mr. Walmarth, I was looking at the mobile. Do you have a quick definition of what that means in your at-risk category?
And Mr. Chairman and Director Schmidt, that is defined under the department's Chapter 8 rules. And it is a student who moves schools within the school year within that district or another district. So if a student transitions from a high school to an alternative high school within the district between October 1st and a spring enrollment snapshot, that student would be counted as a mobile student. If they move from Laramie County School District Number 1 to Crook County between October 1st and the spring snapshot, they would also be considered a mobile student. So it's intra-district or across districts.
Please.
Thank you. And that, I guess that would also include a child or a student that moves from a district placement to a court-ordered placement in a residential treatment center or some higher level of care.
Mr. Chairman and Director Schmidt, it may or may not. So if the student unenrolls from a district and then re-enrolls in that time frame, they would be counted as a mobile student. But if that district has continuous enrollment of that student within its district between the initial enrollment date and they are continuing providing any services, whether it's through the court order placement, they will still be counted amongst their average daily membership and would not be considered mobile.
Good. So Matt, before you sit down, I'd like to kind of, and I apologize to the task force for kind of this work group unconventional committee meeting we're having, but I'd like to follow up on some conversation and come back to Chairman Baldwin, your committee, and Dr. Ballard. So we've said, as we contemplate this bill, and as we heard what Matt has presented, if I'm understanding the conversation, or my sense of the conversation is, again, we feel that the schools need to have the capacity to intervene, to screen, to make referrals, and to monitor, you know, that component of monitoring. So and this is non-special ed services that we're providing. What don't we have the capacity there to do now? We don't have enough school counselors to screen? Do we not have enough school counselors? If we need to fund this to get it done, that's fine, but can you help us really understand where, if that's the direction we're looking on responsibilities for the school, where's our deficit at under our current structure?
Mr. Chairman, I definitely think we hear time and again from the counselors, right? Like, they have so many responsibilities. And so many students they take care of, right? Like, I think, right, we heard that from public testimony earlier today. I think that there is a significant shortage of staff to be able to do all of the different things that are being asked of school counselors at this point. I also think, I do think there's an issue with the school nurses as well. I think that they are often a front line of communication and connection with these kids. I think we talked about it earlier, right? Like, they could be coming in with, feel nauseous, and what they really are dealing with is high anxiety, right? And so they're often one of the ones to pick up those pieces. And in reality, like, school nurses, sometimes they're, one day a week I'm here, and 2 days I'm at that school, and then I'm at the third school the next 2 days. And so when they're not there, the school secretary is the one that kind of fills in the meantime. And so I think there's some issues, there. Mr. Chairman, I am curious with Mr. Wilmarth, if you could tell me, like, I know you said you were paying with like the average like teacher salary for districts. If you could give me an idea of, like, I'm concrete, that's abstract to me. Like, what does that look like? Like, what's the dollar value connected to that?
Mr. Wilmarth.
Yeah, Mr. Chairman and Dr. Ballard, it varies by district.
Of course.
So in Teton County, it's on average in the model, it's about $80,000 just for salaries, plus their health insurance and other benefits. On statewide average, it's about $56,000 through the model.
That's helpful, thank you.
And that's just the salary, doesn't include the compensation. Compensation would add another $20,000.
That is very helpful, thank you, Mr. Chairman. That's kind of what I think I keep hearing from folks, right, is not having some of those resources. We also talked today about some of the case management pieces and making sure that the districts have enough capability and capacity to make sure that they're able to follow and manage, those cases with the students. And well, I think, right, school social workers and things like that help with some of those pieces. I think having additional staff to support that would be helpful. And I think that's contained within like the pupil support. And with what we're talking in here, what Mr. Wilmarth provided, right, with the increasing in staffing, I think a lot of that gets covered in here.
So if I may, if we fall back on the 2020, if table 1 on the last page of the memo, that's the 2020 recommendation, recalibration recommendation. Is that correct, Matt?
Yeah, Mr. Chairman, you are correct.
And so that would reduce pupil support, right? And would add school nurses and counselors. So in the bill, do we accommodate for the reduction of pupil support? And are we saying with the needs, because I hear we've got this coordinator, are you going to use, I'm trying to understand here what we're trying to accomplish with the bill, and it may be fair that you use a counselor in this coordinator position. I get that, but I just want to understand if that's your intent, because we would actually in that funding model, the way I see it, if we're following that, reduce the pupil support numbers and increase nurses and counselors.
Mr. Chairman, I'm not sure how to answer that question. The reality is, when we look at who those people are, they are not in the districts right now in Project Aware. They are not school counselors necessarily. Like in that community project manager, they're not necessarily like a former counselor moving into that role. They could come from a lot of different backgrounds, right? That's not necessarily what it is. I think if you give them the capacity, I mean, we're talking about that in terms of like one person per district, right? I mean, is what if we look at like what it would cost from the Project Aware side, I mean, I don't think this fully covers everything that's in doing another Project Aware, but there's a lot more inside of that than just funding staff.
Well, if we may, and Matt, if you don't mind, unless you've got other meetings you have to be to, Anna, would you mind coming up? And let's go through 24 LSO 0208, the school finance, and talk about that, because, and Matt, maybe while she's coming up there, in the school model, if we just left as is, and a district wanted to hire a person to be this coordinator position that we kind of keep floating around, they've got the resources to do it within the flexibility of the model, and it's not prescribed or that it has to be a person with a certain degree. And they're allowed to do that, correct?
Yeah, Mr. Chairman, that's correct.
Yeah, and so just want to make sure that if we're prescribing in the bill that they have to be under this discipline, a counselor or that's the type of person that you want to have for some of these positions, or are you really just focusing on getting more counselors in a counseling position in the school? What is it we're trying to accomplish in sum total in getting these extra positions into the school? So Anna, would you walk us through this bill, please?
Of course, Mr. Chairman. Mr. Chairman, members of the committee, this bill draft's entitled 24 LSO 208, School Finance, School Counselors, Pupil Support, and Nurses. This bill draft provides supplemental financial assistance for school districts to hire additional school counselors and school nurses. The Department of Education shall notify school districts of their eligibility to participate in this financial assistance program, and financial assistance will be based upon the prior school year's attendance and configuration reports. Pupil support positions will be generated at a rate of 1 position for every 125 at-risk students.
What page? Keep us on the right page,
I'm
would you,
sorry.
Anna?
Sure, I'm on page 3.
Page 3, okay.
And then at the bottom of page 3, counselor positions will be generated at a rate of 1 position for every 288 elementary school students and 1 position for every 250 middle and high school age students. And then on page 4, nurse positions will be generated at 1 position for every 750 students. D on page 4 indicates that school districts may use these funds to contract for services rather than hiring permanent staff. And then there's also a sunset date of June 30th, 2026 in E on page 4. And then starting at the top of page 5.
Anna?
I'm sorry, go ahead.
Can I, you want us to interrupt you as we go, or?
Of course.
Thank you. So on D there, that would still suggest that districts to use these funds have to use them for the disciplines specified. So they have to be those people in pupil support, those type of specialists, counselors, or nurses.
Yes, Mr. Chairman.
Okay.
Mr. Chairman, I would just add, this provides the current flexibility to utilize these across all those positions, but it also, which I presume districts are doing, which we don't pick up in the analysis I provided, may contract for those services outside of actually hiring the person. So they may actually contract with a hospital for athletic trainers or nurses or some other type of position. They don't necessarily have to have them on the payroll through the FTE count.
And thank you, but I guess as I was focusing on the discipline there, Matt, would it prohibit you from hiring an administrator who's not necessarily a counselor, a nurse, or one of these disciplines or do we have the flexibility in pupil support to maybe hire whatever that administrator is, but it's not a healthcare type professional? Does it have that flexibility?
Yeah, Mr. Chairman, I think the department could certainly probably get rules that,
Okay.
provides that flexibility. But as I indicated, the pupil support is a generic term, and a project aware coordinator could be hired underneath that umbrella.
Thank you. I just want to make sure we're not painting ourselves into a corner. Please continue, Anna.
Yeah, of course. Now we're at, okay, section 2, which amends attachment A of the 2011 Wyoming Session Laws, chapter 185. It shows how pupil support staff shall be calculated with the exception for the 2024 and 2024 to 2025 and 2025 to 2026 school years. It just amends how pupil support's going to be calculated for those 2 school years. And that's it.
Mr. Chairman, I'll just add some context to what you're actually amending. You will not see the formula for the K-12 funding model in your green books. It is actually through a session law that's been amended multiple times, and it's what we call an attachment, and you'll see it attachment A. And so all the prescribed formulas, a majority of them, are through a session law. And so this is why we have to go into a 2011 session law to amend the funding model's formula. We're not amending a current statute.
And we have school years, correct me, I just want to make sure we have these 2 school years down there because then that brings us up to the next recalibration. Is that correct? So we had done that in 2011 to take us up to, and we had followed that up through where we currently are with the last recalibration.
So, Mr. Chairman, the intent of these 2 school years is to get this bill or the modified formula through the next recalibration to let your recalibration in the 2025 interim inform any future modifications to the formula.
Would this action influence the recalibration process?
Mr. Chairman, I think it would. The reporting requirement you have on page 4 in subsection D requires the districts to report how they're expending these dollars to the Department of Education. And I would hope that the legislature would utilize that information to see how they're actually expending those resources, similar to this. So are they hiring more counselor positions than the model is allocating? Are they hiring fewer pupil support positions? Are they hiring more or fewer nurse positions under the new revised formula? And hopefully that information is utilized as a discussion point through your recalibration process to see if the formula under the 2020 recommendations need to be modified in some manner.
Thank you. Anna, please continue.
Of course. Section 3 on the top of page 6 provides a reporting requirement where the Department of Education will provide to the Joint Education Committee findings and recommendations regarding the hiring of pupil support positions, school counselors, and school nurses. And then section 4 provides an appropriation of $125 million. As the staff comment on the next page outlines, this appropriation is for the full amount for all of these positions, not just the additional positions. So that accounts for what seems to be a pretty large appropriation. And then section 5.
Can we stay on section 4 for just a second? So when we pull it out categorically, we leave the funds in the model. We don't bring the funds as we pull that out with it.
So yeah, Mr. Chairman, let me kind of fill in here. The block grant works in a manner that if you pull these 3 or the pupil support and counselor components outside the block grant, that reduces the foundation program entitlement payments to school districts from state appropriations, and it increases the recapture amounts from those school districts that are recapture. The net change is what you see on table 1 of that August 4th memo, is a annual increase of approximately 15 million per year. I think the staff comment on page 7, line 11 indicates the estimated biennial cost would be 31.6 million increase.
And that's what I was wanting to, thank you. That was a clarification I wanted to make sure. So it wouldn't be a new infusion of 125 million by the time we do the true up, if, for lack of better terms, we're going to see an annual increase of about 16 million. Correct?
Correct, Mr. Chairman, through a corresponding expenditure decrease in a separate budget and a corresponding revenue increase from recapture payments, the net would be a total increase of new spending of approximately 31.6 million.
And all impacting the school foundation program.
Correct, Mr. Chairman, and that's where it's appropriated from.
Yep. Okay, thanks. Go ahead, Anna. Oh, I'm sorry, Dan.
Yeah, thanks, Mr. Chairman. So on page like 3 and 6, it says pupil support positions, and then on page 4, it's pupil support specialists. And I guess my concern, my overall concern, is there a definition somewhere of what pupil support is? And I know you've listed all the categories, but I mean, I think I know what I'd like to get at, but I'm not sure that's more
Oh, I see.
what audiologists or pathology assistants, and they're all important. But I'm wondering if we can define somewhere, either by a federal classification, what falls under a pupil support specialist or position. Is that somewhere else defined, or is there a way to define so we don't have districts saying, well, that's actually pupil support and that's pupil support, and it's not getting to what I think this committee is hoping we get to?
Mr. Chairman and Representative Zwanster, I think two approaches could be taken. One, you could define it within the legislation, within the new section that's created. I would request some flexibility in working with the Department of Education based upon its methodology used within its reporting. Or the alternative would be to require the Department of Education to define the allowable positions under that category. So it could be done through the legislature defining those or the Department of Education defining those.
Follow up?
Can I just follow? I mean, do other people think that's a need, or am I guess my question is, when I look at that list, I don't want that much wiggle room. I understand we need some, but was that a concern to anyone else, I guess, is my question, or am I being too definitive here?
My question would be is when and I believe it's in rule now, is that, or is it anywhere?
Mr. Chairman, the only methodology that has been utilized to inform what pupil support is from the Department of Education's work with the School Finance State Advisory Committee to identify the positions to include in this FTE analysis. And if it's the desire of the legislature and this task force to put more sideboards on what that definition is, if you want to hone it on to family, outreach, social workers, non-nurses, pupil support isn't a nurse, pupil support isn't a counselor. You want to focus it on school psychologists that aren't special education, I think it's appropriate for the legislature to weigh in on what that looks like. Or the default would be to leave it to the Department of Education, but then you lose the ability to define what that is.
Dr. Ballard?
Mr. Chairman, I'm trying to wrap my head around it. When we're talking then about school, like the pupil support is more than the mental health pieces that we've been talking about. And so if we're defining it, I want to be careful, like audiologists and hearing screening coaches, occupational therapists, physical therapists, right? Like they are not your mental health counselors, but they are definitely needed in districts. And I want to make sure that we're not, whatever we do, we don't take away that ability for them to use these funds for that, because it's not funded some other way in the school district. They just they're part of this pupil support, right? That's right, Matt, correct? I hope.
Mr. Chairman and Dr. Ballard, for the non-special education positions, yes.
And so I think what we're trying to get our head around it is if we're comfortable with what for example, the list on the back of the summary where we talk about those various disciplines or professions that we see as pupil support, in that we're not getting so broad that includes a recreational therapist or a bus driver or some other need within the district, music therapy, maybe that's, I don't know what those are, okay? And so I think Chairman Zwaniter's point has some validity. Do we, for the sake of this bill, define it as mental health pupil support? Do we, or are we comfortable enough with pupil support because many of those things fit there? But if we don't have some guidance there, that's what always gives us a little concern.
Mr. Chairman, if you define it as mental health pupil support, then what happens to the audiologists, right? Because we're pulling pupil support out of the model, and now you're saying it has to be mental health, and the audiologist isn't really a mental health pupil support. That's my concern.
Well, that's fair.
So, I mean,
Okay.
I feel like between the department and what is the committee? The School Finance Data Advisory Committee, is that what? Between the two of them, right, we could create the rules that say this, right? I mean, and
Mr. Chairman, another alternative is to remove the restriction on those funds under this bill draft and only limit the positions to counselors and nurses, as those are more clearly defined and known. Is you could modify the block grant attachment A to allocate pupil support positions under the ratio that's recommended, but leave it within the block grant, not have to define it, and only within your bill draft, allocate the counselor and nurse positions. But I would caution, you do lose some intent of your work in that the pupil support positions have been utilized for social workers, for these other kind of social workers, a speech pathologist, a school psychologist that don't serve students with IEPs. And so if your intent is to ensure that that pupil support funding is to be utilized for those purposes, then keep it in. If it's your intent to allow greater flexibility to districts and not have to define what that pupil support category is, I would keep it within the block grant.
If we leave that within the block grant and then we add the additional counselors and nurses, we're adding an 8.2 million then to the price tag annually, right?
Mr. Chairman, that's correct. Or you could modify attachment A to mirror what the recommendation from the 2020 recalibration was.
Yeah. You opened up that can of worms, Dan, so.
Well, Mr. Chairman, I think the overall concern is that these are quality, professional, highly trained people working with our kids to get them the support they need. And so as much as I value all parts of the education system and paraprofessionals, when we say these are specific, we're going to appropriate more money. I mean, I want to make sure it's going to what the need is, and I don't want to be overly prescriptive. So I'm not sure if we can have it the best of both worlds and say with this extra appropriation, these are kind of the requirements we would like met. So I hate when you said it was, well, you either need to do it this way or that way. If there's some in between that this is additional money we are putting in for this kind of specific needs that we're seeing that we don't think are fully being addressed, and maybe that's part of the block grant, we can't help it. But if there is a way, I think we're all getting to the same point. I don't want to be overly prescriptive, but I don't want it to be so flexible that it is anything counts as peer support. And maybe that's just a requirement back to the Department of Ed that says, here is what we are counting, or here is, I don't know, but I think there has to be, before we agree this to go prime time in February, that needs to be further delineated and defined so we're on the same page and we know what we're getting for our money.
So do you have a recommendation? Are you comfortable leaving it where we're at?
Mr. Chairman, I think for today, certainly, but before February, if this moves forward, or if this has to go to another committee for review, I guess I'd like some more elucidation on if we can categorize or define or give it up the Board of or Department of Education to do that. If we can add, them having rule and reg authority. I don't know what the best way forward is. I just would like some more specificity in the side boards before presenting this to the full legislature.
Okay, so we'll try and, if we move the bill, we'll have further discussion on it and some possible further questions. But Anna, please, I think we're on section 5.
Mr. Chairman, Section 5 is just an immediate effective date, and that's the entirety of the bill, and I'd stand for any questions.
So Committee, it's 12:02. I'm inclined to finish this component, then take lunch. Is there anybody that's faint and swoon here that, are we okay with that? So, okay. I'd like to take public comment on the bill, and then we'll decide if we take action on the bill. Please, if you two wouldn't get too far away, you're just critical in this whole conversation, please. Public comment? Any public comment online, Katie? Okay, public comments over. Committee, what's your pleasure? Okay, we have a move and a second. Discussion. Laurel?
Just, I have one that's just kind of minor. In section 3, line 7, it asks the department to, when we report back to include recommendations for refinement of the components of the block grant. That's not typically the role of the department. That is the role of the consultants that advise the legislature. So just, I'm not sure that is, we have the expertise to really be able to do that.
Let's come back up. Can you, maybe as you guys crafted this, your thoughts on that, is that
Mr. Chairman, we could modify the language to have the I mean, the information's already being provided to the committee. I mean, you could strike that language or delete that language. But I do think it's probably appropriate for the department to weigh in on, all of their projects that they have going on, the Project Aware. I understand the school finance consultants have their recommendations on the block grant during a recalibration, but the consultants interview school districts, they interview department staff. The department does have a position on whether or not this is working or not working. I think the legislature should be informed on that.
so? If we change that to at the end of page 6, where it says section 1 of this act shall include, make a reporting process with any recommendation. I think we need I agree with you. I think we need a reporting process. I think Dr. Ballard has some validity there, that we're not asking them to act in the consultant's stead. So
yeah, Mr. Chairman, and I'm sensitive to that, and I think the legislature should be as well. And maybe it's not within the refinement of the components, but perhaps refinement of the law. And should this be continued as a categorical grant? Should this be folded back in to the total block grant to the districts? Is this a burden for the department to administer separately from the block grant? Is it a burden for the districts to continue to report annually on these components? And so maybe from that respect, it's not necessarily the components, but on the operation of the program that was created.
So as we get ready to work the bill, kind of be ready, and maybe we can work out an amended language, okay? So the question I have, so we pulled this out of the block. I think the term you use is categorical grant, is that right? And you'll front load that to the districts. So they'll have that available, or is it reimbursed?
Mr. Chairman, if you go to page 2 in subsection B on lines 16 through 20.
Yes.
That last sentence that says the department shall distribute assistance to each eligible school district under this section, the same proportion and schedule of distribution under 21-13-313C for the applicable school year. To translate that to you, what that means is districts will get paid 10 times a year. 15% would be paid in August, 10%
Okay,
in
yep.
September through April, and then 5% in May.
So what happens at the end of the school year, now that this is a categorical grant specific for this purpose? What happens if during the course of the year that position isn't filled? What do they do with the funds that aren't unspent?
Mr. Chairman, I think that's a good policy discussion as part of this. So under section 4, on page 6, lines 19 through 26, there is the ability for this money to be reverted from any unexpended, unobligated funds. But there isn't necessarily a directive to revert it from the districts to the Department of Education. I think that's a policy call for this task force in the legislature is, do you want the Department of Education to look at the total expenditures and then any unexpended funds from the districts be reverted on an annual basis or at the end of the biennium? That's a policy consideration I think you need to consider.
So committee, my concern that we see as we review budgets, from time to time, we see that appropriations made for a purpose and sometimes in a specific, that will end and those funds are left somewhat stranded there. They can't spend them for anything else and program goes away. And so I really like seeing some way of making sure that, and I don't know if any, but I may make that as a biennial recommendation that the districts revert any unused funds back to the Department of Education, and we can vote on that, but that's the purpose behind that question, is just trying to make sure that we don't, because we're making this pretty specific. Or Matt, could you say they could be carried, well, but we only got them, you could carry them over too, I guess, but they still have to be used for this purpose, but we don't know what we're going to do in recalibration. But it could be for these 2 bienniums. Anna?
Yeah, Mr. Chairman, I mean, the districts are limited under page 4, subsection D, to only expend those funds for those purposes. It doesn't say within each of those fiscal years. I mean, they could theoretically expend it over the course of the next 5 years. But I think that's a policy call for the bill, is whether or not you want a reversion of those funds from the district to the department and the department back to the state. Okay. There is not that step. The step is if the appropriation that you provided to the department is more than what is necessary, then the department will revert from its budget or its allocation back to the foundation program account. There is not that additional step where you examine the district's balances from these funds and have them revert it.
Perfect, thank you. Any other discussion? Okay, let's walk through the bill for amendments, okay? Page 1, any changes, committee, that you'd like to make there? Page 2. Page 3. Page 4. Sensing there may be something there. Dr. Ballard?
Mr. Chairman, I'm still not.
Can you hold just a second, Anna?
Mr. Chairman, there is one technical correction on page 4, line 12. I would just change pupil support specialist to pupil support position,
Thank you.
just to make it clear throughout the draft.
Technical.
Just technical,
Technical.
right.
Thanks, Chairman Swanson. Okay, back to you. Laurel?
Mr. Chairman, I'm not used to doing amendments, so I'm just gonna, I think that we could put something in here that talks about you know, like we're reporting back on, is this right, right? Where am I? Hold on. No, Mr. Chairman, this isn't where I was planning on going. This is page 4, 2 pages over. Yeah, right?
Where you at?
I'm on page 6. but-
Okay. Okay, page 4. Page 5. We're good on page 4. Page 5. Page 6. Messing with you, Laurel. Sorry.
Okay, so Mr. Chairman, I do think, right, you've got that we're going to provide a report to the Joint Education Committee
Section 3.
on section 3, lines 2 through 10, right? Talking about providing the education report and the findings and recommendations. I do think you could put something in about program effectiveness or evaluate the effectiveness of the positions. And I think that kind of gets to what Mr. Wilmarth was talking about, right? Does this really work? You know, I mean, I think that some, like a program effectiveness or evaluation of this would help with that.
Yeah, Mr. Chairman, maybe some generic language of, you would delete lines 8 through 10, and then after for refinement of on line 7, this program created under this act. Just leave it generic, and this allows the department to weigh in and where it believes it has its expertise.
Okay. Dan, is that a second?
Sure, Mr. Chairman, that's a second. Can I make a comment, though?
Yes, now let's
I mean,
discuss it.
I guess overall, how do we know that this is beneficial and working? I mean, is there a metric? We're going to do this, spend another 15, et cetera, $1 million. I don't always understand. We come back in a year, you know, and the department looks at what do we need refined. I mean, I'm still trying to work on what's the metric that we know it's working, that we have kids accessing services, that school violence goes down. Is there, it's not like reading and math scores I can quantitatively assess. So maybe that's a very generic question, but one, you know, if anybody wants to try to answer, I'd be appreciative.
Dr. Ballard?
Mr. Chairman, I mean, we certainly do this kind of work, right, with like Project Aware, and kind of looking at, that's why I was kind of thinking about program effectiveness, is kind of looking at some of the metrics that we put into there to look at whether or not these are having the kinds of impacts that you hope it would have. But I'm not sure I know how to define them in those statutes.
Okay. Question on the bill, or question on the amendment to make the change. We'll give you some little latitude there, Matt, to make it work. Those in favor say aye. Aye. Those opposed? Anything else on page, we're on page 6. Page 6. I would like to propose an amendment in section 4 that requires that any excess funds left over for school years 24-25 and 25-26 be in the districts not for this purpose, be reverted back to the Department of Education. And I don't know if that needs to go further. Should it be reverted back? Because I'd like to just see it go back from whence it originated. So would that be back to the school foundation program?
So, Mr. Chairman, I think we can do a two-step reversion process. The first would be from the districts to the Department of Education. The Department of Education would revert it back to the Public School Foundation program account.
Okay.
We'll craft the language we understand the intent.
Okay, if I get a second, okay. And I think I've kind of highlighted, we're kind of doing this anomaly, we're pulling it out for these 2 years and taking it out of the model. If it had been in the model and would carry forth, that wouldn't bother me so much. That's kind of why I'm limiting it to those two years. And then as they recalibrate, and if it goes back into the model, they can carry on what they normally do. So any other discussion? Not question on the amendment. Those in favor? Aye. Aye.
Aye.
Those opposed, if any?
Mr. Chairman, just one comment. and this gets a little bit into the weeds, but the action from the Joint Education Committee yesterday that forwarded an external cost adjustment for the next school year would potentially impact this and leave it short for the biennium. So big picture, any external cost adjustment that is adopted by the legislature this session will have an impact on the total appropriation under this bill. I don't think you have to adjust this bill yet. You could come in the supplemental budget and we could refine any necessary shortfall from this appropriation.
Sure.
But I just want to make sure that since this operates as if
Yes.
it were in the block grant, the salaries and the compensation paid under that would influence how much is necessary to fund this program.
Right, understood. Yeah. Dan?
General question, this bill, if approved, is still going to a standing committee of the legislature, or almost certainly education committee, at which time, I don't know if you'd be prepared by their next meeting, what, November, to make those numbers work? That is correct. That is going, Chairman, to education likely?
I'm looking for guidance from my esteemed leader. Would that be her preference? I think so my opinion, I think it could go to education or appropriations. I think it fits either one. And if, so let's do, you what? Yeah, I think what we'll do, what I would suggest is I'll visit, me and Madam Chairman will maybe visit with our education chairman, see if they have any heartburn with it. They've got a pretty full plate, and ours is not as full as it historically has been. Senator Barlow, please.
Thank you, Mr. Chairman. So maybe I'll wait until you're finished working the bill and I'll just provide some general comment. Thank you.
Okay. Would you like to comment on the bill before we vote?
If the bill working is done, yes, sir.
Okay.
So, Mr. Chairman and members of the committee, I'm very hesitant to interact to provide legislation at this time that interacts with the school foundation program. In my view, you just take section 4, you assign the amount of money you want, you define the mental health services, grant programs you want, and you move forward with that and do not interact with the school foundation program at all. So this would be outside, in addition, grant-based, and let those districts, come forth with their plans, allocate money based on the population or the student numbers, et cetera, but not interact with the school foundation program, the block model. As we know, there is litigation under that right now. And I don't know that it's a good time, having lived through 3 recalibration efforts, it's a good time to start interacting with that. I agree with the purpose of this bill. I just don't know that this is the vehicle to utilize it. Thank you, Mr. Chairman.
So, and thank you, Senator Barlow. So, Matt, any thoughts on that? So, as we talk about the statutory model, and this would certainly impact that, I guess. I don't know if you can or provide us some insight. Does that negatively impact trying to maintain current position to where, as this matter is discussed in the course, that we don't adversely impact anything that might be associated with? Is this a valid concern, I guess?
Mr. Chairman, I'll sidestep this question. I'm not your attorney on that. Ms. Hytrek in our office would be more appropriate to advise the legislature on any potential litigation risks, doing stuff piecemeal outside of a recalibration process or during the current litigation. I don't want to provide any advice on that.
So I think maybe what I would suggest, valid question, but maybe we could move, let's vote on the bill, and if it moves forward, we'll take that into consideration in standing committee and talk about how that impacts that further. And maybe we can get a little insight from Tanya. Laura?
Mr. Chairman, just so you know, the superintendent is still weighing and considering the bill, and so I'm going to abstain from voting when we vote. Just letting you know.
Tell her we're voting on the bill and to let you know.
Yes, Mr. Chairman. In the meantime.
Yeah. Dan?
Mr. Chairman, I don't know, is Ms. Heitrick in today? Is it possible we could, take lunch and then take the vote on this after perhaps some legal guidance right after lunch? If, I'm not even sure if she's available, but maybe we could call the superintendent and check with Ms. Heitrick and maybe have a clearer idea before we vote, and just delay it for an hour.
Mr. Chairman, Representative Zwanster, she is in today. I don't know what her schedule looks like. I can certainly touch base with her to see what her availability is to advise. I'm not sure how it works with advising a task force with executive branch and legislative branch members. I'll have to ask about that as well.
And that was the component that I was a little concerned about was. I think this task force a little wonky with executive and legislative branch. I'd prefer that if we're going to get advice from LSO staff attorneys, that they're advising purely legislative members. And we don't flirt with inappropriate actions. So I think I think it's a valued, I think we need to get input, but just not in this manner. So,
Mr. Chairman,
please.
just to signal my hesitancy, the bill is a big bill, it's a big ask, and it's complicated. And so I think for now, I intend to vote aye to continue to have this discussion, recognizing that this will not be the bill draft that goes to the legislature, and to provide some cover for our executive branch friends who may not feel comfortable voting quite yet. There's an opportunity to, again, provide an opinion to the standing committee, who will have to adopt the bill and then take it to the legislature, which again will have numerous times for review. I do think that there'll be big hurdles both with the Education Committee and the Appropriations Committee. Yesterday, the Education Committee did move to adopt the full recommendation of adopting the new external cost adjustment, so additional funding for K-12 education, which of course I don't need to tell anyone about is a challenge for the state. And adding to that concern is what this bill does, simultaneously responding to the needs of our youth that are certainly experiencing these mental health concerns. So tough decisions for us to make. I think the conversation warrants continuation, but I will signal my concern of the bill later down the road.
Thank you, Madam Chairman, and to the committee. I would just echo those remarks. I've been trying to think of a diplomatic way to voice that concern, because there's two fair arguments. One is the increased cost, and one is the unquestionable concern that we hear from our constituents on mental health challenges, posing challenges. And so I think we're going to have to seriously weigh those. And so I too have had concerns and feel that but I think we need to, I will vote for a standing committee, because I think that's a more pure legislative process to have this discussion in than is the task force. So I echo those concerns. Okay. Senator Barlow.
Thank you, Mr. Chairman. I thank you for the discussion on that particular piece. I guess, I think, I don't know what the timeline is when you get to another standing committee. I think most standing committees, with the exception of appropriations, only probably have one meeting left. So if we went to education, they would have one meeting. It seems like they'd have to have a second meeting if we were going to follow a more standard committee process for a new bill draft and a new committee. So anyway, so I think there's probably an alternative to be dealt with, but it's probably done as an individual bill. Bringing in bringing in a grant program, similar to what we did with, prevention, in 2015 and 16, but actually directed through the schools. So anyway, I think that maybe this moves forward, I assume, but I think there's probably some other approaches, and I'm concerned about just the timeliness of the process, besides the heavy lift that both you and Chairman Nethercott spoke of. Thank you.
Okay. Any other comments? I think we're ready for a vote. Katie?
Mr. Chairman, this is a roll call for 24 LSO 0208 for the task force recommendation. Senator Barlow?
No.
Senator Nethercott? Representative Summers?
Excused.
Representative Wanitzer? Co-Chairman Larson?
Aye.
Co-Chairman Baldwin? Director Johansson?
No.
Director Schmidt? Aye. Deputy Director Babbitt? Dr. Ballard?
Abstain.
Chicken liver.
6 aye, 2 no, 1 excused, 1 abstention.
So committee, I'm just going to, with the chairman of appropriation here, just recommend that we send it there and see if we can visit with Chairman Nicholas and get that. I know you will. Okay. Fair concerns. All right. It's 12:30. Will an hour do for lunch? Are you ready through this afternoon, Elise? Okay. Very good. Thank you. Thanks to you who commented.